We're live.
All right. Good afternoon, everyone. My apologies for the late start here. That's my fault. And Senator King, I see you here. So thank you for your patience. Today is Tuesday, February 8th, 2022. We have 9 bills on the docket, and we'll start off with Senator King with Senate Bill 331. We'll then move on to 286, 338, 298, 106, 324, 326, 375, and 328. So with that, we'll start off with Senator King with Senate Bill 331. Senator King, the floor is yours. Welcome.
Thank you very much. Mr. Chairman and members of the JPR Committee, during the 2019 legislative session, this committee passed legislation that created a pilot program to offer a full treatment of HIV prophylaxis for victims of rape, sexual assault, or child abuse. Prior to the enactment of that legislation, victims could only receive a 3 to 5 day treatment. They had to obtain the remainder of the 28-day treatment recommended by the CDC on their own, whether through their insurance company or out of pocket. The pilot program was for 3 years, which ends this coming September, and we placed a fiscal cap on the program at $750,000 per year. For the first 2 years of the program, 1,147 sexual assault victims qualified for the medication. Of that number, 328 chose to take the medication through the program. This resulted in a total reimbursement for both medication and initial and follow-up care of just over $700,000. Again, this was for a 2-year period, well below the $750,000 annual cap. Senate Bill 331 will remove the sunset and make this a permanent program, and it would also remove the fiscal cap. Victims of rape and sexual abuse have been through enough without the additional worry of contracting HIV. This legislation will ensure that healthcare needs are addressed for victims of sexual assault, and I request a favorable report.
Excellent. Thank you very much, Senator King. And next we'll move on to your panel. And first up, we will go to Ms. Jordan. Ms. Jordan, you're up. Welcome.
Chair, members of the committee, I'm Lisa Jordan with the Maryland Coalition Against Sexual Assault. We're here in strong support of Senate Bill 331. Thank you, Senator King, so much for this bill and also for your unflagging support of sexual assault survivors across the years. It's just delightful to be able to come in front of you and say this is a successful program. This is something that you have done, you've created in Maryland that truly helps sexual assault survivors. Imagine being sexually assaulted, fearful of contracting the health-shattering, life-shattering disease, HIV, being told that there is medicine that can help prevent HIV, but then being unable to afford it. This program, this pilot program, cured that. It said we are going to give survivors the ability to get this medication, and really it was a compromise to have it a pilot program, to put that cap on to limit the costs, and the costs were far less than expected. So this is a solid program. It helps survivors. It's a simple lift the sunset, allow all survivors to seek the medicine that they need. And so we urge a favorable report.
Excellent. Thank you very much. All right, next we'll move on to Ms. Jessick. You are up. Welcome.
Good afternoon, Mr. Chairman, Mr. Vice Chair, and members of the committee. I'm Laura Jessick. I'm the Sexual Assault Initiative Victim Notification Project Manager at the Maryland Coalition Against Sexual Assault. I'm here at the invitation of our director, Lisa Jordan. MCASA is the coalition of rape crisis centers across the state of Maryland, and our office includes the Sexual Assault Legal Institute, where we provide direct representation to survivors of sexual assault in Maryland. We are here in support of Senate Bill 331, which removes the sunset for the pilot program for preventing HIV infection for rape victims. This program has been successful since its implementation in 2019. Sexual assault is a violent crime that leaves rape survivors in fear for their safety, privacy, and physical health. In fact, 91.9% of rape survivors are afraid of contracting HIV. Although prevention medication exists, it is often unobtainable due to the short time from for initiation of treatment and the exorbitant cost. Without a program for preventing HIV infection for rape victims, Maryland survivors will need to travel to clinics and other medical facilities after an invasive sexual assault forensic exam to obtain this critical medication. Survivors will be forced to provide their pharmacist with a prescription of sensitive nature that puts their private matters on display. And to afford the medication, rape survivors will often have to decide between their health and affording rent, groceries, and other basic needs. These are all unacceptable burdens to place on survivors, and Maryland can afford to eliminate those barriers. To conclude, establishing the program for preventing HIV infection for rape victims as a permanent resource will provide survivors with access to HIV prevention medication while protecting their safety, while protecting their privacy and reducing the stress survivors face after experiencing a violent criminal act. With a permanent program, Maryland is telling rape survivors that their health, safety, privacy, and life matter. For these reasons, we request a favorable report on Senate Bill 331.
Thank you very much. Next, we'll have Ms. Bolts. You're up. Welcome.
Good afternoon, Mr. Chair, Mr. Vice Chair, and esteemed colleagues. My name is Dr. Jessica Voles. I'm a forensic nurse practitioner and the clinical director of the Forensic Medical Unit at Adventist Healthcare. I'm happy to be here today. In 2019, I was here talking about the dream of a program that would support sexual assault survivors by providing potentially life-saving HIV prevention medications, or NPEP. I'm happy because through legislative support, that dream came true. I'm happy because the work didn't stop there. Through collaborative work with groups across the state, a streamlined system that vastly increased access to these medications and the process of obtaining them was established. I can report to you today that our program provided NPEP medications to 100 survivors, age 7 to 54, who experienced sexual assault and abuse because of this legislation. The new process for accessing NPEP is done in a way that respects and protects patient safety and privacy and eliminates cost as a barrier. The good news doesn't stop there. The care, concern, and efficiency of the Terrapin pharmacy that provides these medications has ensured that 100% of these patients receive their medications in time for their next dose. They've worked diligently to eliminate wasted medication, unnecessary administrative hours for our nurses, and transportation issues for our patients. This has been a truly unified effort that saves time, money, efficiently achieves its goal, and let me be very clear, most importantly, because it does the right thing for victims of sexual assault and abuse in Maryland. I'm here today to tell you that even during the challenging times of the pandemic, there are some things that have had a positive impact for these survivors, made things a little easier than they were before. And I'm happy to report that this is one of them. I urge you to support Senate Bill 331 so that we can continue to do this good work and ensure that Marylanders who have experienced sexual assault and abuse are supported as much as possible on their path to wellness. Thank you.
Thank you very much, Ms. Voles. All right, we'll now go on to Ms. Krinke.
Thank you, Mr. Chairman, and good afternoon, members of the committee. My name is Jane Krinke. I'm here today on behalf of the Maryland Hospital Association and our 60-member hospitals and health systems. Hospital-based sexual assault forensic medical programs across the state, like Dr. Volz's, deliver trauma-informed care to survivors of sexual assault. And state law ensures that those survivors do not incur any out-of-pocket expense for the treatment they receive. Maryland hospitals are in strong support of Senate Bill 331, which would make the NPEP pilot program permanent. This program has successfully removed barriers that have historically prevented survivors from accessing HIV prophylactic medication. We've worked closely with our partners at MCASA and the Sexual Assault Reimbursement Unit to refine the pilot program through creating streamlined reimbursement forms, hosting webinars, and we really appreciate the collaborative work that has happened. The SARU was instrumental in establishing a relationship with Terrapin Pharmacy, a mail order pharmacy that really expands access to this medication even further. And so we are happy to stand in support and hope that you'll see the true benefits of this program. And so we ask for a favorable report for Senate Bill 331. Thank you.
Thank you very much, Ms. Krinke. And if I'm not mistaken, that'll round out the panel of witnesses and we'll conclude the testimony for Senate Bill 331. And I'll turn to the committee for questions. Seeing no questions, that will conclude the hearing for Senate Bill 331. Thank you very much to Senator King and to the panelists. All right, next we'll move on to Senate Bill 286 with Senator Huff. Senator Huff, you're up. You've got two coming up here, so I think we've got your witnesses for 286 up. Would you like to go in order?
Be happy to. Thank you, Mr. Chair. And I'll be brief. Both these bills I'm going to present, Senate Bill 286 and Senate Bill 338. This will be the fourth time that this committee has heard these. They've passed through the Senate 3 times previously unanimously. So obviously, as this is my last term in the Senate, I'm giving it the last go here. So Senate Bill 286 simply says that a person may not be denied the right to own a firearm if they use medical cannabis in the state. We have passed this bill unanimously 3 years in a row. In recent years, Maryland has greatly expanded its programs for the use of medical cannabis. And quite frankly, this year, we're talking about the legalizing cannabis. Yet people that use medical marijuana who are gun owners are placed in a quandary. They can either give up their Second Amendment rights or continue to take their medical prescription. This is a choice no citizen in Maryland must face. Indeed, under current law, a person can have a medical prescription for drugs like Oxycontin or other opioids without facing the prospect of losing their firearms or criminal penalty. This simply makes no sense. Since medical cannabis is legal in the state, it should not conflict with one's right to own a firearm. Critics may say this bill sets up a potential conflict with existing federal law. However, the tension between state and federal law is a basic concept of federalism, and quite frankly, it's one that we grapple with and deal with constantly on the issue of marijuana, whether it's decriminalizing, legalizing, medical. We're constantly dealing with a tension with federal law. And of course, there are times when the state must be more innovative than the federal government. So again, I would ask that the JPR would again unanimously pass this to remove this prohibition on those who are law-abiding citizens that own a firearm, and just simply deciding to take advantage of Maryland's law that allows the use of medical cannabis.
Excellent. All right. Thank you, Senator Huff. We'll now switch over to your panel and we'll start off with Mr. Pennick. Mr. Pennick, you're up. Welcome.
Thank you, Mr. Chairman. It's good to be back. I wish to make clear that as to SB 286, we are not opposed to this bill. We filed testimony as informational only, and it's only because I'm intimately familiar with this issue from years past and from my prior stint at the Department of Justice that we offer the testimony we have. We support virtually everything that Senator Huff just described in his opening remarks. We do point out that there is a strong tension between this bill and federal law, such that it may lead individuals to have the mistaken impression that with a medical marijuana card from Maryland that they would be able to purchase a firearm. Attached to my written testimony is a sample of the most recent version of Federal Form 4473, and you'll notice at the bottom it is highlighted. It is a categorical disqualification to purchase a firearm in the United States if you are a medical marijuana user. And that relates strongly to the handgun qualification license, which people have to take 4 hours of training and pay an instructor and pay the fees to the state in order to get. And yet, even armed with that handgun qualification license, they will not be able to truthfully fill out Form 4473. And if they don't truthfully fill that out, it's a federal felony, 10 years in prison. So we are concerned, and it's simply a concern, that people will be misled into spending money and energy and time getting Maryland certificates like the HQL and be unable to use them in Maryland because of federal law. The federal law on this is utterly clear. The use of marijuana remains a crime under federal law, and it still will subject these individuals to arrests, searches and seizures, and incarceration. So I'm happy to take questions on this. I've answered them before the committee, and I'm happy to do so again.
Thank you very much, Mr. Pennick. We'll take questions at the end of the panel. And next, we just have one more panelist, Ms. Novotny. You're up. Welcome.
Hi, thank you. I'm Katie Novotny. I'm coming to you from District 35B. And I support the idea of this. But there's a lot of pitfalls. So in my testimony, I've suggested a possible amendment stating just that the effective date of this bill would be once the federal law removes marijuana from a Schedule I drug. I think that would take care of, that Maryland would, immediately legalize this once the federal level legalized it, but that we wouldn't be creating pitfalls for citizens.
Excellent. All right, with that, that'll conclude the testimony for Senate Bill 286. We'll now turn to the committee for questions. All right, seeing no questions from the committee, that'll conclude the hearing for Senate Bill 286. We'll now switch over to Senate Bill 338. Senator Huff. Senator Huff, you're up.
Thank you. Another bill that the committee has heard multiple times, has passed this legislation 3 times unanimously. And so many times when we start talking about legislation down here, we talk about pro-gun, anti-gun, what side does this fall on? To me, this is just a common sense bill. If you take out the word firearm, and I was going to say this was about any other subject of getting a license, and I explained it to you, you would say that's common sense, and it would have passed by now. I'm not sure why the House keeps holding it up. Basically, what the legislation does is it allows a preliminary approval for a handgun permit. So right now, in order to carry one, I have one. I got one this year. That's my card. In order to do that, I had to go through and I had to pay a couple $100. I had to sit and I had to take training, and it's actually pretty good. They teach you about Maryland law, the surrounding state law. You go out and shoot, you show proficiency. It takes a number of hours to do it. It costs a couple $100 to do it. And I knew, because I had called ahead, that as elected officials, that we are in a assumed risk position. And now there's a whole separate argument, who should get the permits or not. This is not that. But I had a pretty good idea I would get it. But if you're a regular citizen and you go and apply for the permit, you really don't know. I mean, you may think you're going to fit in, you may think because you carry money or not, but you don't really know. And so what the state of Maryland says right now is go ahead, pay the money, take your time and do the class. And if you get denied, well, too bad, but you had to do that first. This bill just says you can go to state police at a time. They'll give you what's called a preliminary approval. They say, hey, thumbs up. We looked over this, you fit the criteria, you carry money, or, you're assumed risk position, whatever. Or they'll say, you don't, we're not going to give you one. Don't waste your money. Don't waste your time. And if they say preliminary approval, you still have to do the class. You still have to do everything just as you would before. You don't get one of these until you've done everything required. All it does is just say, the state police will say, thumbs up, thumbs down, don't waste your time. Very simple, this concept of preliminary approval. It's clear in the law that you don't get it without doing the classes, training, and everything else is normal. It's a completely common sense bill. I hope the House will come around and pass it again this year. We've done it 3 times in a row. And that's it. Thanks.
All right, thank you very much, Senator Huff. We'll now go on to your panel, and we'll start off with Mr. Pennick.
Thank you, Mr. Chair. This bill makes so much sense for all the reasons Senator Huff has outlined. It has passed both houses of the General Assembly at one time or another and just failed to come to fruition. We supported this in the past. This is enormously commonsensical. It doesn't change the requirements of Maryland law at all, except for the requirement that you have to get do all the training prior to even apply. This allows you to apply, get preliminary approval, and then go off and complete the very expensive courses. I would say, Senator Huff, if you only spend a couple $100 on this course, you got a deal, because the courses are much more expensive than that in my experience. I teach this course, I charge more than that. So this is a very good bill. It should be adopted once again, and I would urge this body to give a favorable report.
So thank you very much. All right, next we'll go to Ms. Novotny. You're up.
All right, thank you, Mr. Chair. Again, I'm going to support this bill. I'm Katie Novotny, District 35B. So I again encourage you guys to support this bill as you have in years past. And I appreciate that you've supported this common sense bill. And I certainly hope that this is the year that we can get this pushed all the way through. I'm an ordinary citizen. I don't currently have a carry permit. I actually just did the training 2 weekends ago. My husband and I both went through the training. And, you know, we outlaid a significant amount of money for him and I to both do that. And, you know, we're certainly hoping that the Maryland State Police is going to, you know, find that we have a good enough reason to get a carry permit. I may have a bigger chance than my husband, but you know, we spent an entire weekend. We both work full time. I'm in school. You know, we have a lot of obligations. So spend an entire weekend doing this when we frankly don't really know that we're going to get this. You know, is a big deal. And if we can change that and just make this process a little bit simpler for everybody, I think that would be great. So I urge a favorable report.
Well, thank you very much, Ms. Novotny. We'll now move on to Mr. Jocelyn. I'm going to ask to unmute you. Let's see if one more time. There you go.
Good afternoon, Mr. Chairman, members of the committee. John Jocelyn speaking on behalf of 2A Maryland. We also support this legislation. It does not change the criteria to get a carry permit. It simply changes the sequence of events. By so doing, you're able to eliminate a lot of effort that would otherwise go into it. Just to put it in perspective, in 2021, the Maryland State Police processed 18,431 applications for a carry permit. By enabling them to give people a very quick yes or no, you're going to save an awful lot of people, citizens who are already reeling from the pandemic, a lot of money and a lot of time by knowing right up front whether or not they should continue the process. It's good for the citizens, it's good for the Maryland State Police, and it's good for the state of Maryland. We hope that you will once again return a favorable report. Thank you.
So thank you very much, Mr. Jocelyn. Okay, that will conclude the testimony for the proponents of the bill. We'll now switch over to the opposition, and we have Ms. Good. You are up. Welcome.
Hi, good afternoon. Thank you to the committee and the committee chairs. My name is Willow Good, and I'm testifying on behalf of the League of Women Voters of Maryland, and we urge an unfavorable report on SB 338. The League supports gun safety educational programs before any kind of handgun permit is approved. For these reasons, we urge an unfavorable report. Thank you.
Thank you very much, Ms. Good. All right, and with that, that'll conclude the testimony for Senate Bill 338. I'll now switch over to the committee for questions. All of us are intimately familiar with both of these bills. All right, seeing no questions, that'll conclude the hearing for Senate Bill 338. Thank you, Senator Huff, and thank you to your panelists. We'll now move on to, is Senator Young here? There you are. Senator Young, welcome. Senator Young with Senate Bill 298.
Thank you, Mr. Chair, Vice Chair, and members of the committee. Good to be back. Senate Bill 298 provides public health officials and hospital staff protection from written or verbal threats of physical harm. Protection that Maryland law currently does not provide unelected state officials, unlike 35 states that do have protection in place for public health officials. During the COVID pandemic, the number of threats against public health officials and hospital personnel has increased significantly, leading to skilled workers leaving the profession and adding to the medical staff shortages. Senate Bill 298 protects against written and oral threats that relate to physical abuse. The bill does not curb free speech relating to differences of opinions about health issues, nor does it prohibit a written or oral discourse of genuine disagreement from occurring. The bill specifically deals with threats of harm, not actual physical attacks. There are already plenty of laws on the books protecting citizens from physical attacks. The bill is restricted to only public health officials and hospital staff workers because they're viewed as a cohesive working group of medical workers directly tasked with protecting the health of others in a public arena. Finally, the bill specifies consequences for violation of the law consistent with other state laws. I would like to point out that we have had 8 counties weigh in supporting this. The Maryland Nurses Association has weighed in supporting it. And I think it's a much needed addition to our law to protect these officials. I know we have lost a couple of the county public health officials because of threats. So I would ask for support of Senate Bill 298, that you vote favorably on it, and that Maryland values civility and respectful treatment of our public health officials and our medical personnel and hospital staff. So at this point, unless there's questions, I would like to move to our panel.
All right, thank you very much, Senator Young. We'll now move on to your panel, and we'll start off with Mr. Krinke. Miss Krinke, you're up. Awful lot of folks in this room right now, so excuse me a second to toggle over. Hey, is she here? Is Miss Krinke here? There you are. All right, gotcha. It's like the Hollywood Squares version of testimony.
No problem. Thank you so much, Mr. Chairman. And good afternoon, members of the committee. My name is Jane Krinke. I'm testifying on behalf of the Maryland Hospital Association's 60-member hospitals and health systems. We're here in support of Senate Bill 298. So as you know, Maryland is facing a staggering healthcare workforce crisis. There are more than 3,900 nursing vacancies statewide, which is a 50% increase in just 5 months. So our healthcare heroes have been on the pandemic front lines for now more than 700 days. And on top of those challenges, they continue to face rising occurrences of workplace violence. The CDC's National Institute for Occupational Safety and Health and the US Department of Labor include threats and written actions intended to control or cause death or serious bodily injury in their definition of workplace violence. And Senate Bill 298 rightly adds those protections for health officers and hospital staff to protect them from threats made against them. Violence in the workplace takes a toll and can lead to higher staff turnover, absenteeism, deterioration of employee morale, and burnout. And so we support the intent of Senate Bill 298. We do think that modifying the definition to broadly cover all employees would just make it stronger, since those who could be affected aren't necessarily, regardless of their job title and duties, they could be impacted by violence through threats. And so hospitals' top priority is the safety of their patients, staff, and visitors. As you'll hear later from Mr. Smith and Mr. Jago, they'll testify to what hospitals and health systems are doing to make sure their hospital is a safe environment. And Senate Bill 298 offers those tools to support them. And so for those reasons, we ask for a favorable report. Thank you.
Thank you very much, Ms. Krinke. Next, we'll go on to Mr. Smith. Welcome. There you are.
I think I'm unmuted. Thank you, Mr. Chair, Vice Chair, and members of the committee. Thank you for your time. My name is Larry Smith, and I'm the Vice President for Risk Management Services at MedStar Health. I'm also the chair of the Associate Safety Program that oversees our efforts with regard to workplace violence prevention. And I'm here because MedStar supports strongly Senate Bill 298. We do suggest a change in the bill to make it available for all healthcare workers, not just a few. I want to just emphasize a couple of issues. One is what Ms. Krinke said about how serious we take this issue. This is one of the most important issues that we're dealing with regard to our staff and the safety of our people. I also want to say that Senator Young, I think, nailed it when he talked about this is not just an issue of safety for our staff. It's a public health issue because people are being driven out of the healthcare field because their fear of the risk that's associated with working in a dynamic healthcare environment. We're seeing it literally almost every day, and it's very real. Let me tell you, MedStar has taken a number of steps to try to prevent workplace violence from occurring. It's not totally preventable. We'll do everything we can to try to protect our staff. Let me just mention a couple of issues that might bring it into light in terms of how serious this is. We have just finished a program of training all of the folks who work in our emergency departments, behavioral health and security, not just around de-escalation, trying to calm a situation down, but defensive skills so they can protect themselves if they're attacked. I never thought I would come any place and describe the fact that we now have a campaign to teach our folks how to fight for themselves when they're under physical attack. That's literally what we're dealing with. We also, however, have trained over 8,000 personnel in de-escalation. We do believe that's a major effort that all of us have to participate in, trying to calm these situations down to not have them result in harm. But in addition to the prevention efforts, we also need to get a message, I believe, to our team, our staff, our healthcare heroes on the front line, that we care about them and that we will provide this protection for them when they're under attack. Today is Tuesday, and I've already had 3 incidences that we're dealing with regarding folks who have had their life or their safety threatened since the weekend. So please, I urge you to vote favorably in connection with House Bill 298. It's really important. Thank you.
All right, thank you very much, Mr. Smith. All right, next we'll move on to Mr. Jago.
Good afternoon. Can you hear me okay?
We can.
All right. Thank you so much for hearing my testimony. Larry, thanks. You stole some of my thunder, I think, on things I was going to cover, but let me move along. My name is Christopher Jago. I'm the Director of Security here for LifeBridge Health. I'm here today to speak on behalf of the dedicated healthcare professionals here at LifeBridge and expressing our support of Senate Bill 298. LifeBridge Health is one of the largest and most comprehensive providers of health-related services in the greater Baltimore region. We consist of Sinai Hospital of Baltimore, Levendale Geriatric Center and Hospital in Baltimore, Northwest Hospitals in Baltimore County, Grace Medical Center in Baltimore City, formerly Bon Secours, and Carroll Hospital in Carroll County. I think we can all agree that hospitals, physicians' offices, pharmacies, clinics, and other sites which are open to the public should be places of refuge and service for individuals who are sick and seeking medical care. In reality, threats of violence and acts of violence are too common in the healthcare setting, and they are increasing in both occurrence and severity, as my friend at MedStar has pointed out. Threats and acts of violence are made by patients, families, and visitors to our facilities. Many are specific in nature and directed not only towards the staff members, but to their families. Among just our 5 hospitals, we average 31 reports a year. These are still an underreported matter because many healthcare professionals unfortunately have decided that it comes with the job. And that's a heartbreaking statement that we have to deal with and break that cycle. So what is the impact? Violence-related injuries are 4 times more likely to cause healthcare workers to take time off from work, and that's more than any other workplace injuries. This directly hampers, as pointed out, the ability to provide critical patient care. The experience of workplace violence has not only physical consequences, but emotional, personal, and professional consequences as well. Our healthcare heroes are literally and figuratively being beaten down, and we need your help. Here at LifeBridge Health, we are actively working to prevent workplace violence. We utilize electronic systems for reporting and tracking incidences of workplace violence. We've implemented zero tolerance policies, provided training on identifying and managing aggressive behavior. We've installed expensive surveillance technology and access control systems and disseminated personal wearable alarms and computer panic buttons. On the physical security side, we've added off-duty police officers. We've hired special police officers and trained them and increased our security officers' staffing roles to enhance our visibility and response time to incidents. Finally, I'd like to note that all staff in healthcare are subject to the matters I've just discussed with you, from our clinical personnel, such as physicians, nurses, and therapists, to our non-clinical staff, such as patient transporters, social workers, food service providers, environmental care services, and our security officers. On their behalf, we'd request a favorable report for Senate Bill 298. Thank you so much for your time.
Thank you very much. All right. Next, we'll move on to Ms. Torton. Brooke, you're up. Where are you? There, you try one more time. There you go.
Yes, here we are. It said I needed to be unmuted. Thank you. All right, good afternoon. My name is Brooke Torton, and I am an attorney. I work at the University of Maryland Carey School of Law in a few different grant-funded positions. The one that this committee may be familiar with is the Legal Resource Center for Public Health Policy. I'm here today in my individual capacity in support of this bill. In my role with the Legal Resource Center, I have significant contact with public health officials, including health officers nationwide, but really specifically here in Maryland. At the onset of the pandemic, so almost 2 years ago, there was a significant jump, an increase in threats and harassment aimed at public health officials, making it far more difficult for them to do their jobs in some circumstances. So in order to determine what protections already existed at that time, rather than reinventing the wheel, I conducted a 50-state survey to see whether there were laws that criminalized threats and harassment made against public health officials, and or laws that criminalize interference with official duties. We heard some about that from Senator Young. So 35 states plus Washington, D.C. had these laws on the books. 15 states, including Maryland, we did not. And so while we do have a current law on our books in the criminal law article, it protects local elected officials and some state officials from serious threats made against their lives or threats to cause serious bodily harm. It's not broad enough to encompass public health officials. And also, most importantly, what we don't have on our books, that law or another law in our code, is that there's nothing that criminalizes or prevents a law that would prevent public health officials from doing their job, so impeding the duties of a public health official. For those reasons, I would urge you to give a favorable report for SB 298 and to join these other 35 states and Washington, D.C., who do have such a law on their books. Thank you.
All right, thank you very much, Ms. Torton. We are now joined. I see that our county executive from Howard County is here. Welcome. You are up next. Our apologies for the fiasco in the waiting room, but welcome. Good to see you.
Well, patience is a virtue, and very good to see you, Chair Smith, and the wonderful members of the Judicial Proceedings Committee. I'm Howard County Executive Calvin Ball, and it's a pleasure to be with you this afternoon to talk about a critically important issue. We've seen our local health officers and healthcare workers courageously at the forefront of this unprecedented pandemic. Many of us here today will echo the same sentiments that Senate Bill 298 is necessary to help ensure that our healthcare workers are safe and able to continue caring for our community. At the start of the COVID-19 pandemic, none of us expected that our healthcare heroes, our health officers who are saving the lives of our residents, would suddenly be subjected to death threats. Initially hailed as heroes, while hospitals were overflowing with patients in critical condition, the science was still evolving, and a vaccine wasn't even yet on the horizon. Yet, they demonstrated dedication daily. But through the highs and lows of the pandemic, healthcare workers across our great state have been harassed, terminated, or resigned simply for doing their jobs. They are making data-informed decisions in real time, and while they may not always be popular, they have saved countless lives. Prior to the pandemic, the healthcare industry already faced significant turnover. In the face of COVID, staffing shortages continue to rise. Their mental and physical health are frequently tested, and many still keep coming back for us. For those who have remained in this field, they should not be subjected to threats of violence simply for doing their jobs. I'd like to thank Senator Young for introducing this measure and to express extreme appreciation for one of your co-sponsors, especially Senator Clarence Lamb. As many of you know, as many of you know, Senator Lamb has continued to work as a physician and fulfill those responsibilities throughout the pandemic, in addition to his role here at the state Senate. I would also like to thank Howard County's own health officer, Dr. Mara Rossman, who serves as the president of the Maryland Association of County Health Officers and has worked tirelessly to help ensure the safety of Howard County residents and visitors. Protecting our healthcare heroes is a critical priority, and I'm encouraged by this legislation that would do so. I thank you for your continued partnership, and I humbly request a favorable report for Senate Bill 298. Thank you.
Excellent. Thank you very much, Mr. Executive. Always good to see you. And again, my apologies for the waiting room fiasco. All right. Next, we'll move on to Mr. Stoner. If I can find you. There you are.
Okay, can you hear me?
We can.
Okay, thank you. Good afternoon, Mr. Chairman and committee. It's a pleasure to be here. I'm Earl Stoner, the health officer here in Washington County for the health department, and I'm speaking in support of Senate Bill 298 on behalf of the Maryland Association of County Health Officers. Just to reiterate a lot of what you've already heard, we've been in an unprecedented time mired in the pandemic that we're in, and understandably, no question about it. It has been a grind for individuals. Health officers at the forefront of it. We've had like 24/7 weeks and days, and even for us, it's been a grind. But we've had unprecedented levels of harassment, intimidation, threats thrown our way. As health officers, our main goal is to really put out recommendations and make decisions that are founded in science, they're evidence-based, and they're really not about controlling people. They're about saving lives, as you heard before from some of the other speakers. Personally, unfortunately, I've had threats against myself, harassment, intimidation. I've had my child harassed at school. And certainly these sorts of things continue to take a toll on myself as health officer. Other health officers in Maryland and across the country have received even greater, more grave threats than I have. And again, these are really unprecedented times for us. A current law exists to protect elected officials, and from our perspective as the Maryland Association of County Health Officers, we're urging this committee to support us being put into a position where we also have these protections. Again, we understand and we respect the fact that people have the right to state their opinion and to have a voice. Again, no questions asked about that. But the individuals who have continually spoken out and intimidated and threatened, really with no consequence, we really, really, really need to have protections. And so for that reason, we are here to voice our support of this important legislation. Thank you.
Thank you very much, Mr. Stoner. Now move on to Mr. Gales.
Good afternoon, Chairman Smith and Senator Young. Thank you for sponsoring this bill. Thank you for the opportunity to speak with you all. I am a former health officer from Montgomery County, Maryland, and speaking as a witness for MACHO in support of SB 298. The stories and anecdotes that have been shared so far have eloquently laid out the strifes and tribulations that healthcare workers are experiencing, not only in the state of Maryland, but across the country. It's well documented, particularly for public health officials, including health officers. I would like to reference my testimony that I gave on behalf of the House Committee several weeks ago, where I shared one of the emails that I received in the threatening language. I won't reread that today, but please reference that as a sense of the tone and type of behavior that has been directed against us. I would like to use this as an opportunity, though, to give voice to the other health officials who are on the front lines, including our licensing and regulatory teams who are going out and issuing the citations and have throughout the pandemic had to be on the front lines in terms of ensuring that the laws and regulations of the state and local jurisdictions are upheld. They have faced significant pushback and significant resistance. But I would also like to point out that many of those functions are things that the world of public health has done before COVID, will continue to do through COVID, and will continue to do long after COVID hopefully leaves our society. So it's important to not only think about those larger threats and that language, But in the world we live in right now, given the evidence that we've seen in other jurisdictions and unfortunately here locally, it's hard not to take these threats seriously. And we should not be put into that position to have to do so while balancing what we feel is right, what we know to be right based upon the evidence and science in our efforts to keep our residents safe. So in summary, I would ask you to strongly consider giving a favorable report and moving this piece of important legislation forward. It will not only help protect healthcare workers, but it will also set a tone for our children who are watching us and looking to us to be signs of motivation as we continue to move through endemic. Thank you.
Thank you very much. All right, next we'll move on to Ms. McFarland. Is Diane here? All right, I don't see her. Sandy, is she here? Is she in the waiting room? Oh, there you are.
Okay, can you hear me now?
We can.
Okay, great. Thank you. Good afternoon, Mr. Chairman, Senator Young, and members of the committee. My name is Dr. Diane McFarland. I'm a registered nurse and the Chief Nursing Officer at Frederick Health in Frederick, Maryland. I'm honored to represent the Frederick Health nurses today in favor of Senate Bill 298. I've been a nurse for 30 years, with 20 of those being in a leadership role. I currently have oversight of 1,500 employees, with over 1,100 of them being registered nurses. 1 out of 4 nurses report being assaulted either physically or verbally during their career. For Frederick Health, that means 278 of our current registered nurses have experienced this. As Chief Nursing Officer, it is my responsibility to ensure nurses practice in a safe environment. The COVID-19 pandemic has significantly increased threats and assaults to nurses. We've seen close to a 200% increase in aggression and verbal abuse alone. Some examples of acts of aggression that have occurred against Frederick Health nurses over the past 2 years have included a nurse being violently pushed in the chest and being told by a patient that they were going to come back with an AK-47 and kill all of you. A patient throwing an IV pole, barricading himself in the bathroom, and making verbal threats to harm the nurse if they tried to come in and help him. A patient screaming at the top of their lungs and using profanity because all they wanted was a glass of water. A pregnant nurse being yelled at, hit, and thrown against a window in our ED triage area, and a home health nurse having patients yelling profanities at them and throwing her laptop at her head because they just had a question about their plan of care. In what other industry are these types of acts acceptable? And it's really not something that we can accept as a risk of our trade. It is estimated that 500,000 nurses will leave the nursing profession in 2022, and that will create a shortage of 1.1 million nurses. We cannot afford to lose any more nurses, especially to verbal abuse or threats. Currently, 38 states have established or increased penalties for assaults against nurses. Unfortunately, Maryland is not one of them. The passing of Senate Bill 298 is critical so that we can protect and retain a nursing workforce that is committed to caring for you, your families, and our fellow Marylanders. Thank you for the opportunity to represent the voice of nursing on this very important legislation.
Thank you, Ms. McFarland. All right, next we'll move on to Mr. Nibber. Welcome.
Thank you, Mr. Chair, Mr. Vice Chair, and members of the committee. My name is DePaul Nibber, representing the Maryland Association of Counties in strong support of SB 298. MACo chooses 4 priorities for each legislative session, and seeing a great need to protect our workers, our county leadership chose to lend their support to SB 298. As you've already heard, under the pressure cooker that is the COVID-19 pandemic, our public health workforce has experienced extraordinary levels of harassment. In addition to punishing threats by bad actors, this bill reaffirms the importance of our local health departments and the services they provide. It prevents the discouragement some Marylanders may feel in pursuing careers in public health. The attrition we see in the public health ranks can be, at least in part, attributed to daily harassment and threats experienced in the workplace. We already extend the protections of SB 298 to elected officials because they are forced to make difficult, large-scale decisions for the benefit of their constituents. The same is true for our health officials and their teams. They deserve the same treatment under the law. For this reason, MACO supports SB 298 and urges a favorable report. Thank you.
Thank you very much, Mr. Nibber. All right, next we'll move on to Miss Odell. Am I missing Miss Odell? There you are. She's going to go on with Miss McFarland. Are you going to, is that the same? Is that right?
Yes.
Okay. Welcome.
Good afternoon. My name is Michelle Odell, Master's Educated RN and Hospital Supervisor at Frederick Health Hospital with 30 years of nursing experience. I'd like to start by thanking the delegates for the opportunity to speak on behalf and in support of Senate Bill 298 and its importance of impacting healthcare systems across the state. I have personally encountered physical abuse while working, to include being kicked in the stomach when I was pregnant, scratched and spit on. I've been threatened, intimidated, bullied, harassed, and verbally accosted. I've witnessed my coworkers being punched, placed in headlocks, strangled, and having bodily fluids, including urine, feces, and semen thrown on them. These egregious assaults on staff contributes to fear, anxiety, and extreme burnout of healthcare providers. We have worked extremely hard, especially these last 2 years with the pandemic and increased volumes flooding our healthcare system. It is difficult to focus on the medical aspect of our profession while dealing with physical and verbal abuse. I find it disparaging that consequences have not been enforced. Patients, regardless of situations, need to know these behaviors are unacceptable and will not be tolerated. Targeting healthcare providers is impermissible. On behalf of healthcare workers across the state, I implore you to pass this most significant bill. Thank you for your time.
Excellent. Thank you very much for taking the time to testify and share your insight and your story and your personal experience.
You're welcome.
Next, we'll move on with Ms. Resnick. Ms. Resnick here. There you are. I see you. Toggle over to you.
Hello, thank you, Good afternoon, Mr. Chair, Mr. Vice Chair, and members of the committee. My name is Beth Resnick. I am a senior scientist in the Department of Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health and a lifelong Maryland resident. I'm here today in support of this bill. It is the job of public health officials to protect the health of their communities. In a democracy, dialogue is necessary. Disagreement is inevitable, but there is no place for attacks and harassment against public health workers. From death threats to protests and even shots fired at their homes, public health officials across the country and here in Maryland have been the focus of attacks that have been added to the already immense pressure that they are experiencing as they do their jobs to prevent illness and death. In the first 9 months of the pandemic, our research identified over 1,500 incidents of harassment across the country, and this harassment continues today. In a 2021 CDC study of public health department employees across the country, 26% reported experiencing stigma or discrimination, 24% reported being bullied, and 12% reported job-related threats. This reflection from a local health officer captures adequately what the public health officials here in Maryland and across the country have experienced throughout the pandemic. I get threatening messages from people saying they are watching me. They followed my family to the park and took pictures of my kids. I know it is my job to be out front talking about the importance of public health, educating people, keeping them safe. Now this job kind of scares me. When they start photographing my family in public, I have to think, is it really worth it? Public health officials came to public health committed to saving lives. They are now leaving in the wake of attacks and harassment, which is depleting and diminishing our public health system. Since the start of the pandemic, 7 Maryland local public health officers have left their positions, leaving many of our counties in Maryland without critical public health leadership just when we need it the most. Senate Bill 298 gives Maryland the opportunity to join the 35 other states and Washington, D.C. in protecting public health officials to do what they were hired to do, protect and promote the health of the public. I urge you to give a favorable report. Thank you.
Thank you very much. All right, next we'll move on to Miss Tenney. I see that Senator Young, are you motioning? Is Ms. Tenney here?
Yeah, I'm still here.
Okay, is Ms. Tenney here? I thought I saw you motioning no. I cannot see Ms. Tenney. Okay, move on to Ms. Ogatis. Is Ms. Ogatis here? There you are, Joanne.
Hi, can you see me?
We cannot see, but we can hear you.
Okay. How
There
about
you
that?
go.
Great, okay. Thanks so much. My name's Josie Ogaitis, and I've been working in Maryland as a nurse for over 20 years. My opinions today are my own and that of the Maryland Nurses Association. Violence is underreported and occurs in all healthcare settings. Verbal threats are a weekly occurrence in the acute care setting. Physical threats monthly. I've seen nurses kicked, punched, spit upon, carts overturned, and threats posted on Facebook Live. We're seeing an all-time high with the COVID pandemic. What ticks patients and visitors off? Often it's common reasons. Preferred pain meds not given, long wait times. Recently, saying no to visitors due to COVID. Hardly reasons to justify threats to the same medical team that's trying to save lives. Nurses de-escalate, we apologize, but there's times when none of that works. The aggressor continues escalating until someone gets hurt. It's demoralizing for nurses. We live in a healthcare culture that accepts horrible behavior with no consequences. Patients or visitors act out because it works for them. They get what they want, then they repeat the same disruptive behavior at the next hospital. They know that staff cannot turn them away as we are bound by EMTALA to treat. Traumatized healthcare workers want to leave the front line. They don't want to come back, and it's further contributing to the workforce shortage. The 500 fine in this bill sends a clear message to the aggressor that their behavior is not okay. It also serves as a deterrent to repeat bad behavior. I would like to comment on what you may hear as problems with this type of bill. First, problems with enforcement. I encourage the committee to look at the airline industry and the successes that they've had with fines and decreasing the number of threats against airline workers. Word has spread in the airline industry. Secondly, the bill could hurt the mentally ill. Nurses and doctors know how to care for the mentally ill. We know many on a first name basis. They respond to treatment. This bill is not about the mentally ill. It gets to the offenders that are unpredictable and unsubstantiated. Lastly, patient rights. This bill does nothing to take away a patient's right to complain. In fact, healthcare facilities are already surveyed on the patient's perception of care. If a patient feels they're not treated with courtesy and respect and the survey's low, facilities don't get their rate money back. Everyone wants to do something for health professionals right now. Given the stress of COVID, passage of this bill is something that the legislators can do. Thank you.
Thank you very much. All right, I see Ms. Tenney. I see you there. Thank you for your patience, Ms. Tenney. You're up next.
Thank you so much for your patience. Okay, my name is Lisa Tenney, and I'm testifying on behalf of the Maryland Emergency Nurses Association in favor of 298. And I'd like to say good day to all of you and thank you for your support in the past when we've testified before you about preserving patient rights and about the tremendous verbal and physical threats the frontline emergency nurses and physicians are under. Because violence and threats have increased during the pandemic, and even before that, we are in favor if there is an amendment made to expand this to other healthcare settings, as other speakers have mentioned. I do want to reiterate that the past 2 years have been brutally for us, physically and emotionally. Our staff is spent and gone. Yet, those of us who remain, we have great empathy for the patients who are so frustrated and angry that they're having to wait to see the doctors and wait to get admitted upstairs. And all that without the benefit of having a loved one with them due to isolation restrictions. And so many have lashed out at us. But this isn't about patients who complain. We all know that under the 2019 Maryland Bill of Rights, which that patients have the right to complain, and they can file a complaint and have that complaint reviewed without any retaliation. As part of every hospital's patient safety program, we encourage patients to speak up because that promotes safety and transparency and trust with them. And all of us are trained how to give them how to complain with the Office of Healthcare Quality, our boards, even with CMS and the Joint Commission. What this bill is about those people that harm us and interfere with our ability to take care of them. And it would be a wonderful tool to add to the workplace violence prevention for me to be able to say to angry patients to help de-escalate them, please stop the threats. They're not helpful. And in fact, you know they're against the law. I don't want to go that route. I want to help you and I want to understand you. Let's just talk. So please give us this tool because it is a de-escalation tool. Thank you very much.
Excellent. Thank you very much, Ms. Tenney. All right, and with that, that'll conclude the testimony for the proponents of the bill. We'll now switch over to the opposition panel. Mr. McAvoy, you're up.
Great. Thank you so much, committee. Can you hear me all right then?
We can.
Thank you so much, Chair. I want to say that I actually testified on this inside the House, and the posture seems to be similar. I also want to say that the testimony today is just as the testimony was last week. It's duplicitous and misleading. If you look at the text on the bill, it's very clear that this actually, if you look at page 1, A2, hospital staff member, that would include it at you had MedStar come. Their sweepers are encouraged to get involved with the patients. You look at A3, that would apply the same for public health officials. It says individual employed by state or local health, that's everyone. So when it was said in the House on this bill that this was narrowed down, the scope is extremely wide. Okay, and why do we know that that is put in this way on purpose? We already have issues of bills that deal with violence against the hospital employees. Matter of fact, you all did a bill the other year where basically hospitals can file on behalf of their employees so that the nurse actually doesn't even have to do it. So if that's not happening, those hospitals that harangued you to get this bill, they got the bill and now they're not doing anything with it. But that's not what this bill is about. And we all know it. This bill is about the stuff that just happened that Governor Hogan was talking about not even an hour ago, where we have laws and policies in effect that are un-American. They're not based on science, and they're wrongful, and people are objecting to it. So when you have health officers and officials complaining that people are giving them guff, maybe they should stick with the Constitution. Maybe they should understand our heritage and the fact that we go with a palliative care approach. That people are expected to go in with their relatives and so forth to the hospital. I thank you for listening. I urge an unfavorable on this. Shoot it down.
Excellent. Thank you very much. And with that, that'll conclude the testimony for Senate Bill 298. We'll now switch to the committee for questions. And I saw that Senator Carter had a question, and then I think Senator West had one if he's still here. Senator Carter, you're up.
Thank you, Mr. Chair. Tried to put my hand down, but it didn't go yet. So thank you for your testimony. I recognize that healthcare workers are essential and that oftentimes they stand in the gap between life and death and wellness and further deterioration and disease. That said, I guess I'm going to direct my question to either members of the panel, but I guess Mr. Larry Smith, who's talked first, because I think that's where my first question arose, or even Chris from LifeBridge. So within the testimony that we heard, first thing I want to talk about is the fact that the things that were mentioned through a myriad of the testimony from different people were the acts of kicking, punching, hitting, spitting, throwing bodily fluids, splattering them, being pushed in the chest. And so I'm well aware, and this whole committee is well aware, that those are not threats, as this bill covers, but they're actually acts of assault that are covered under the law. And so I wanted to first I think it's important to make a distinction, because this bill doesn't address assault, which already exists in the law. It's just a threat. And then that brings me to, I'm getting to my question. I found a lot of the testimony heartbreaking, not because of, it's heartbreaking because I'm thinking about the patients, and I'm thinking about patients being the vulnerable ones here. I'm thinking about the imbalance of power. I'm thinking about patients that are unable to move or leave or do things on their own, and they have to be, they're vulnerable to the care that they're receiving. They may not be able to, especially with the pandemic, so many were in isolation. They didn't even have their family members there to advocate on their behalf. And so because of that imbalance of power, you're talking about a vulnerable person who is at the complete reliance and mercy on the healthcare professional versus the healthcare professional who's a professional. And so I wanted to know, like, why would we, as a matter of public policy, pass a law that would give a special law or treatment to the person ostensibly in the greater position of power versus the individual that's more vulnerable, that doesn't have anything? If there's a threat or some act against a healthcare worker, the healthcare worker is going to have the full weight of that institution come down on the person. They're going to get security, they're going to get the management, they can easily call the police, but the patient, on the other hand, they really don't have any options. And so could somebody address that?
So Senator Carter, I heard you mention Mr. Smith first, so I unmuted him, but is there anyone else you'd like to?
No, Mr. Smith, and if Chris wanted to weigh in, that'd be fine, because you're in my district.
Thank you.
But I'm happy to go first, and I'll turn it over to Chris. What we're talking about here obviously is a complex issue. There's no single solution to all of this. And I do agree with you. And I believe we do a very good job of balancing out the rights of our staff, our patients, their families, all the time. And I think, as Dr. Kenny said, we know how to deal with the most vulnerable. We know how to deal with those who are having mental health issues that might cause them to be disruptive. We know how to deal with those. That's not the population that we're looking at today. I mentioned 3 since Sunday. I'll tell you one of them, and it is, you're absolutely right, Senator Carter. This isn't about the assaults that occur. Those we have tools for. It is uncomfortable to use those tools, but we have tools. This is about something much more subtle and more insidious. One of the calls I got on Monday morning had to do with a physician in an emergency department on Sunday who saw a patient. That patient was very unhappy because they were not able to get narcotics in the emergency department. We're pretty much a no narcotic emergency department. And that was causing the patient to be angry. As a result, there was an outburst. As a result, we did use security, asked them to escort the patient out, but not before he made it clear that he knew the physician's name, that he would find her and he would kill her and her family. That's psychological distress that's caused by that kind. And there is no way right now for us effectively to deal with that issue, because making a threat may even be illegal, but it's pretty hard to prove, and the police are not very interested in prosecuting those kind of issues. So we do need some protection that says when those kind of things happen, you can step in and actually get outside resources to help us deal with the issue. And I'll turn it over to Chris also for his comments.
Thanks, Larry. And again, you stole my thunder.
Uh-oh.
So, Senator Carter, thanks for the question. Very good. Yeah, there are those differences between the assaults, which we currently assist our staff members with prosecuting and things of that nature, and the difference between the ones you heard today, where you've got someone following an official to a park to take pictures of them and to intimidate them. To people that tell our nurses, when you get off, I'll be there with my family to handle our business. Those are very serious, disheartening sort of comments that impact our staff on a frequent basis. I won't say daily, but quite often. And in my background, just so you know, I served the state of Maryland for 30 years as a police officer and 7 years in Pennsylvania as a chief of police. So it's a whole different world for me here in the hospital. And, you know, I don't like to throw around that word hero often, but the folks that are here, that are serving the public, that are doing God's work in healing, they really are heroes. And the threats that are being made against them from the presidents on down to our security officers are things that we need assistance with. And we need another tool in our tool belt to be able to address these issues. I think it's a great way to de-escalate things, to be able to say things like, what you're saying is a violation of the law. And we need to let you know that if you continue on this path, there could be there could be some circumstances where we pursue that. Sometimes people will listen, other times they don't. We just had one not long ago where the patient's family member had COVID, very, very bad case. And when told that they could not visit the patient, they said, well, you better call the police now. I'm on my way there with a gun. So you can imagine, again, that sort of information just floats through the hospital very rapidly and causes undue concern and a lot of things to move into motion to protect all the people that are here in a place of healing. I hope that answers your question, Senator Carter.
Oh, somewhat. I got more of an idea of your perspective. The other thing is that within a multitude of the testimony, just attributable to everybody that was on the proponent side, I heard a couple of other things. I heard that about the exodus of the much needed healthcare workers and the healthcare crisis, the people not wanting to stay in the profession. But the testimony was that they're leaving to job-related problems, that there are issues with termination and discipline. So there was no specific nexus that I heard in the testimony between the actual threat outside of assaults, but actual threat and exodus from the profession. And so I was wondering about any specific data about that, not talking about assaults or just harassment, which is a different issue too. But I mean, I just find it hard to believe that a threat would rise to the level of significance that it would be a major cause of people wanting to leave the profession. And I completely understand being disrespected is not pleasant. It often goes with the job in many of our jobs, but it's still that professional. There's a difference between the professional and the vulnerable. So I guess the question is, there were multiple reasons given why people are leaving the profession. And there were multiple testimonies talking about the way people are mistreated, healthcare workers are mistreated and disrespected. But we're talking about a specific bill with specific language about threat. And I was wondering if there was any specific data about that.
Well, again, I'll jump in, and there may be others who want to, but again, I go back, I guess, to where I start, which is that working in this area, there is no single answer to all the issues that we're talking about. They are multifaceted. I would say I have no doubt, and I don't have the data in front of me, but I know I can achieve the data if you would like, to show that on our exit interviews with nurses, physicians, and others who leave us, that one of the themes that we see more and more of is the concern about the safety of the environment in which they work. I would say predominantly that's in behavioral health, that's in the emergency department, urgent care centers, places where people walk in off the street oftentimes, and we have no idea what they're bringing with them. And all of a sudden we're dealing with those issues. I just met with leaders of the emergency department across the MedStar system, 9 hospitals with emergency department staff, and they are asking us to do even more than we're doing. And I appreciate that we have a responsibility too, because they say just what we said about the issue of staffing. They're having a harder and harder time finding people who want to work in the emergency department. And in some cases, it's in which emergency department, because it depends in some ways on where our emergency rooms are located as to whether they're more and more difficult, more or less difficult, I guess, in dealing with some of the issues.
Is the training on patient care and de-escalation universal, that everyone would receive the training? And how long has it been in place? Has it always been in place? Because you mentioned you've stepped up efforts for de-escalation training.
Yeah, no, it's a great question. And I can tell you it was 2017 when we actually implemented the more comprehensive training approach for de-escalation. Before that, we had pockets of training going on around the organization, but we decided to make that into a system-wide effort. COVID got in the way, there's no question about it. The very first year we were up and running and really doing more than we ever expected we could. We trained in that first year 2,500 associates in physical skills training, literally making them better able to protect themselves in the event of a violent attack. In addition to that, we trained 8,000 of our nursing staff and others in dealing with de-escalation. These are people who have front-facing responsibilities. So they're going to deal with patients, deal with families. Doesn't have to be in a clinical setting. It could be in a finance office, someplace where they've got the potential to have issues that need to be de-escalated. COVID got in our way because this was all being done face-to-face in classrooms. And so we've moved somewhat to an electronic or video model. It's not as good. It isn't as effective. We can't wait to get back to being able to do the classroom kind of de-escalation. And also, you know, we do it through simulations. So we're actually having people practice what they're learning. We have a plan to have another, as soon as COVID allows, to have another 12,000 of we're 30,000 associates altogether. Can't train everyone overnight, can't get everyone in 1 year, but 12,000 associates for de-escalation and 30,000 associates to go through at least a 1-hour mandated training to better understand the issues of reporting, of helping us understand better what's going on in their environments and giving them some tools. So I know it's a long answer, but we're excited about what we're doing on the training side. But you're right, it didn't start 10 years ago. It started 4 years ago at MedStar. And I can't speak to the other organizations. I know they're doing some of the same work we are.
Mr. Chairman, I promise this is my last.
Absolutely. Yeah. I want to make sure Senator Senator Young gets a chance to chime in after Senator Carter's last question.
So I just feel compelled to share a personal experience, which I never do. I rarely do this. But in 2016, my mother became ill and she was in the hospital. And my experience with that situation was rather horrific. Many of the actual physicians, not nurses, not anesthesiologists or other kinds of care workers, but physicians were so rude and so cold that my sister and I had to stand guard at the door to make sure they did not enter to upset my mother, because she was very frail and was in the course of being about to die. And my sister and I my sister more so than I, you know, we have certain coping mechanisms and we have a certain manner. And so we were able to act in a very civilized manner. But being in those very difficult, traumatic situations, as most people and families are put in, I struggle with this so much, because you're talking about death and life. You're talking about losing the closest people to you in the world. And you've got to have professionals that understand the trauma that you're going through and don't make it worse. My specific situation is the trauma was made worse by the physicians, and most of the actual nurses were actually wonderful, but there were many people that came in the hospital room throughout the day, throughout the night, to do whatever they had to do, and they were absolutely disruptive. They had no regard for the fragile state of my mother. And because of that reason, my mother was very lucky. She wasn't in COVID, thank God. And she had 2 daughters that were willing to stand guard night and day to make sure that nobody harmed her or made it worse. Just think about the vulnerable people who don't have that, or who may be not as well raised like my sister and I to know how to conduct ourselves, to not go off on somebody that's causing harm. But I just know that you're dealing with life and death, and you're dealing with regular people who don't ask to be there. They don't get paid to be there. They don't want to be there. They have to be there. It's the only thing they have. And so I just need you to understand what the gravity of what you're asking, because it's our responsibility to consider those very vulnerable people in the situations they're in versus those that are entrusted with the responsibility to offer them the best care. And concomitant with that is the bedside and chairside manner and just simple decency.
Thank you for that, Senator Carter. Do you want anyone to respond? I mean, do you want anyone to respond directly to that? I just want to make sure that Senator Carter.
Also, Ms. Tenney had her hand up.
Yeah.
But that's okay.
Okay.
After that, I'm done. I know it wasn't a full question, but it is a question. The question is, what do you say to that fact that my situation is not unique? Other families are in that situation every single day. And these people that are in there in isolation and don't even have the benefit of their families, they're completely at your mercy.
Yeah. I'll grab Ms. Tenney to respond, and then I want to give Senator Young an opportunity as well.
Oh, thank you. And Senator Carter, you do have great empathy for patients and for the staff, and we appreciate that. And but I did want to respond to two things. One is the Emergency Nurses Association has been one of the leaders in collecting data, and they a few years ago their data showed that 1 in 3 emergency nurses were threatening to leave the profession due to the violence. And I can get that information to you. Also, as far as the de-escalation training, the state of Maryland is one of 8 states that passed the workplace violence prevention bill. It was, Governor O'Malley signed it back in 2014 or 15, and it mandates all of us in the hospitals to have patient safety programs. And included in that is de-escalation training and how to receive complaints and to have just respond to that. The problem is that bill does not have much teeth, and so across the nation, OSHA wants every state to have what Maryland and the other 7 states have, and they've introduced a bill on the Hill, which actually has passed the House last year, the last 2 years, that would put a patient safety program in every single hospital, and then OSHA would oversee it. And then because it would be mandated that way, there would be funds that would flow that would fund the de-escalation training. And so those are 2 pieces. I will say that your situation with your mom, I'm so sorry that happened. We deal with that every single day, multiple times, because people, when their loved one is sick, and it's been terrible during COVID, and we've had to go to great lengths to make sure families and patients get together. It is nuanced, and it is a matter of training and expertise and having the best and the brightest work with upset families. And that's why we need to be able to continue to train people, but we need the people to train them. And if they keep getting threatened, that they want to leave. So it's a long train of dominoes, but at the heart of it all is the patient's right, and the family's right to complain. And again, this is not about a complaint. It's about those that go way over and interfere with our job. So thank you very much.
Thank you very much, Senator Carter. Thank you, Ms. Tenney. So I want to go to Senator Young. You wanted to give you an opportunity to chime in here.
Thank you. A couple of things. I don't know if everyone, but a lot of us have had an experience with a doctor or something that doesn't have the best bedside manners. But if you're unhappy with that, you do have a source of recourse by going to management and the leadership team and dealing with that. This bill was mostly based around nurses and some healthcare officials that are being threatened. And the question came up about studies. Well, the Center of Disease Control and Prevention in 2020, I guess the first year of the pandemic, in a study they released, said that a quarter of public health officials feel like they've been bullied, harassed, or threatened, and 1 in 8 said they received job-related threats. So it's a real problem that needs to be dealt with. There are loads of articles talking about how many nurses are leaving the field and the difficulty of getting more nurses. If we don't find a way to make them feel safe and to not have to deal with threats, we're going to have a lot worse problem than we have now, because we aren't going to have people in the hospitals to help us. They're already feeling those shortages. And as I said, there are just dozens of articles talking about nurses saying they've had it and leaving the field. So I don't think this is that broad, and it's to protect them from real threats, not from somebody being upset and complaining or things like that. We can't have these officials being threatened.
All right, thank you very much, Senator Young. Now I saw Senator West and then Senator Sidnor. Senator West, you're up. I'll unmute you here just before you go on your, there you go.
Can you hear me?
We can.
Great. So I'm sorry, I came in the middle of this, but I think I've gotten most of the gist of it. And I find myself unusually agreeing with both Senator Carter and the Maryland Office of Public Defender on this thing. And I'm doing it because we're trying to criminalize speech here. We're not criminalizing action. So some of the testimony I heard was about kicking and urinating on and throwing feces at. Those are all assaults, as Senator Carter said, and they're already criminal. But what this bill seeks to do is to criminalize words, verbal statements or letters. It's unlikely letters, but let me just give you an example of the concern I have. So I'm really mad at the treatment my wife has been given by the hospital, specifically by a particular nurse. And so I stand there and I say, yeah, I'm going to write a letter to the president of this hospital, and I'm going to tell them exactly what happened in this case, and I'm going to recommend that you be dismissed. Would that be criminal action under this particular bill? It sounds like it's intended to intimidate. Then I look at the Office of Public Defender, and it states that Senate Bill 298 criminalizes verbal or nonverbal communications if the communications are intended to intimidate. You go on and say this language is vague and overbroad and sweeps protected speech within its ambit. I'm not saying I'm against the bill, but what I'm saying is before we pass this bill, I think we need to pay special attention to the possible overbreadth of the language and deal with that in a way which would protect doctors and nurses from genuine threats and intimidation, while at the same time not suggesting that ordinary citizens who are extremely frustrated in a hospital, and people these days are very frustrated in hospitals, and say things out of frustration, that we don't haul them off to jail because they allegedly intimidated people. So, Senator Young, would you like to respond to that?
Sure, here we go. Senator Young, let me go ahead and unmute you here.
This bill is just basically offering the same protections that elected officials already have. You know, there's a difference in saying I'm going to file a complaint against you and that I know where you live. I'm going to follow you home. I'm going to kill your family. I had one when I was mayor. The guy knew where I lived, and he's going to be waiting behind a bush, and he was going to cut my throat and gut me. That's more than just words. And, you know, when you get to the level of threatening somebody like that, it goes beyond. I guess, you know, you can always say, you know, I'm going to report you and I hope you're fired. I think that's, less of something that anybody's going to bring a charge on. So we're not asking for anything beyond what we as elected officials already have.
Okay, great. I bet we can come up with language which more narrowly defines the definition of the word threat with an intent to intimidate than we find in the bill. But thanks very much.
Yeah, thanks.
Senator West, I would say, Ms. Krinke, the way we generally do this is the senator kind of calls on the witness, but I saw your hands up again, so I'm going to call on you before we get to Senator Sidnor, if it's responsive to Senator West's inquiry.
Sure, and thank you. I'm sorry, Mr. Chairman. I just appreciate Senator West and Senator Carter's comments. I think Senator Young summed it up well. It's these very specific threats that endanger someone's life that really impacts our workforce. And we recently heard from the University of Maryland, the dean of the School of Nursing, that's the more that you hear about workplace violence in the media, it actually impacts the nursing enrollment rates. So there are repercussions for these threats. So thank you so much for listening. We'll follow up on some of that data.
Excellent. Thank you very much. All right. Senator Sidnor, you're up.
Thank you. This question is for the Maryland Hospitals Association. I'm looking at a press release from the Department of Justice that kind of goes right to this issue where you had someone who was prosecuted for making violent and explicit threats. And this person is now facing a maximum sentence of 5 years in prison and a fine up for up to $250,000. I'm curious if you could tell me why or whether or not members of your organization have used the federal government in order to deal with these types of violent threats. And if so, why federal law isn't sufficient when it seems to me I'm looking at the words from the U.S. attorney. He says threats and intimidation should not be tolerated. This office and our law enforcement partners will continue to investigate and prosecute such conduct. So I'm wondering, again, if your members have used or ever filed anything or had a case before the U.S. attorney, number one, and if so, I guess I'm trying to figure out what hole this bill intends to meet. Because again, I'm even in looking at the penalty. 90 days or $500. If you really want to send a message, you got 5 years and $250,000 with the federal government.
I can start and then I might pass to Mr. Smith, just because he's an expert on the front lines. I don't think the intent, I have to check if anyone's used those federal laws to enforce. I think it's less about penalizing someone to the maximum amount and just making a clear message that hospitals are safe places where you can come to work and do your job.
Right, but what I'm saying is it seems the law is already there.
I might defer to Larry.
Yeah.
I don't believe I haven't heard about any state hospitals using the federal law against patient.
I'll jump in on to say that I'll take a look. It's been a while since I've had a chance to, and I'll look at it. It isn't the remedy. Again, as I said before, my perspective, there's no single solution, and we're not trying to create an issue where we send people to jail for long periods of time. That's not our goal. We're a healthcare organization. We're trying to take care of people and their families. We're looking for an immediate response. So a federal going after a federal charge is going to be very complicated, and it's going to take a while for that to happen. I'm in the emergency room today. I've got somebody who's threatening somebody's life. I want the police to show up and be able to do something, because oftentimes when they show up now, because there hasn't been a crime committed, they can't do anything. They can encourage the person to leave. They come right back into the emergency department. We can call them again. They come right back into the emergency department. So we're looking for something that will allow us to have a really rapid response that isn't intended to be overly punitive, but intend to get the point across. This is not acceptable, and there is a remedy for us when this happens.
And if I might add or ask, in that particular situation, because I think what I heard was someone saying, we just want to have it as a tool to threaten you with so it will de-escalate. But I'm wondering, if the person who makes the threat is that intimidating, is the hospital in the position where it could say, look, we feel threatened, we're going to ask you to leave the premises, and if you don't, you're going to be charged with trespassing.
Yeah, again, you know how tricky that is in a hospital, particularly when somebody is complaining that they've got some issue that needs to be addressed. And so, the police are most likely not going to take and arrest that person because we just declared that they are trespassers. There's more of a process that's going to be necessary to make that happen. And so I hear you, and I guess what I'm saying is we're not asking for a solution for all that is ailing us with regard to workplace violence. We know it's very complicated. We're going to do our own. We're going to do what we need to do too, which is the training, the de-escalation, and the rest. Can I say right now, one of the tools, when I look at the toolbox, as Chris was talking about, putting another tool in the toolbox or the tool belt. Right now, we have contracts. We can actually sit down with somebody when they're willing to and able to. We can contract with them to have agreement on how behavior is going to occur going forward. And it works, not all the time, but it works. It's a tool. And I see this as one of those tools along the way. You figure out, based on the circumstances, which tool do I use that's going to be most effective in de-escalating this issue. Remember, we're not interested in fighting. We're interested in de-escalating. So this would be one of the tools along the way, one of the methods that we can use along the way that gives us more than we have now.
And finally, I'm guessing in other areas, we've had many of our committee members in dealing with people who are experiencing certain mental or behavioral health issues. We've been trying to create ways to deal with people in those states of mind in ways that we weren't bringing in law enforcement. And I'm assuming if somebody is in this particular state of mind, this bill is now asking us to bring law enforcement back in when we've been trying to send them your way. So, can you help me with that?
Sure. Again, I go back to the issue. I think it's all circumstantial at the time. There are some instances where our intent, just to go back, our intent is not to use this. We would love to find a way in which we don't need to have this available as a tool.
But the committee member is going to say, well, are we passing this law?
Well, wait a minute. Wait. Well, I'll finish my thought. But we're realistic enough to know that even though we don't want to use this, we found this as a whole in the tools that we have available to deal with certain situations. For the most part, we're going to apply de-escalation. All these other things to try to keep this from happening. We go after peace orders. We came last year. I think it was said that we're not using them. We are using them. It's been a very effective way of communicating to patients and to our staff that tool is available if we need to use it. And patients sometimes respond to that threat coming from the hospital. So all of this is laying out some opportunities for us when we have an event occur that we can't control the individual. We can control ourselves and how we respond to it. And that's what we're looking for.
And to that point, I was one of the primary sponsors of the peace order bill.
Thank you.
So, it's a tool that's not criminal in nature, but if I want to be able to access my mother or father, or whomever it may be that's in your hospital,
yep,
and I got that threat, I better act right, because otherwise I'm not coming back into the hospital.
That's why we fought so hard.
That's enough.
That's why we fought so hard last year to get it, because we think it's a very effective tool. I'm thrilled that Maryland has that in place. And I do everything I can to make sure everyone in our system knows about it so that the knowledge is out there to be able to use it when it should be used.
It just seems like that's a more effective, to me,
it's one very effective. We're looking for a second effective.
Thank you very much.
Can I just say to Senator Carter, just for a second, because what I do for a living is deal with issues where we don't do so well. I'm the risk manager for the system, so I get a lot of the issues that come through. We're not perfect, and I think what you represented in your comments was our responsibility to make sure our staff doesn't do violence to patients and their families, emotionally or physically, to make sure. So whenever those things come up, all I can say to you is when they occur, they're not acceptable, just like workplace violence prevention is not acceptable. It isn't tolerated, zero tolerance policy for within MedStar, if I heard about that, or anyone in a leadership role heard about that. So I just want you to know I heard you. I'm so sorry that occurred to you, but I think there are methods of being able to deal with it. And I would urge you all, whenever you confront those kind of issues, let us know, and we'll do everything we can to make it better.
Thank you, Mr. Smith. Senator Helgeman had a question. I have lost Senator Helgeman on the screen. I think she may have had to go to another hearing. Mr. Never, I see your hand up, although we are now on member questions. All right, so I had to step out during that hearing. So Ms. Pop, perhaps you can assist, but to my understanding, we have had everyone testifying and taken member questions. Have we heard from the opposition, Ms. Pop?
Yes.
Okay, sounds good. Any other questions from other members? All right, seeing no further questions, that concludes the hearing for Senate Bill 298. We'll now move on to Senate Bill 106. Senator Washington, you're up.
Good afternoon, colleagues. For the record, Senator Mary Washington, representing the 43rd Legislative District, asking for your favorable report of SB 106. Colleagues, as we all know that about the adage, an ounce of prevention is worth a pound of cure. What we're saying is that no matter how small one takes, or no matter how small the proactive measure, it's much better than being in a reactive mode of the problem. While both are necessary, it means that prevention is better ultimately than the cure. Why spend more resources and energy trying to cure something or prevent an unwanted, or should we rather prevent an unwanted situation? We all agree that violence in our communities has reached an epidemic proportion, and particularly in some of our communities. And it is top of mind for all of us here in Annapolis. Prevention and intervention is the most effective strategy, and it keeps situations from needlessly escalating. We've been hearing a little bit about that today. SB 106 represents a significant investment in this approach. It's asking, I have an amendment actually to the bill to amend it to be targeted specifically to the Crime Control and Prevention Unit and youth programming of the Office of the State's Attorney for Baltimore City. And also it's talking about similar programs for the State's Attorney's Office in Prince George's County. And the goal is to provide grants to community-based organizations that engage in the important work of prevention and intervention. And the best prevention is to create an environment and a set of support systems that engage young people at the critical ages when they make life choices. So this bill requires the governor to include in the annual budget bill an appropriation of $500,000 to the Crime and Control Prevention Unit and youth programming, and a similar grant to the Prince George's County State's Attorney to fund violence prevention and community service initiatives. Passing SB 106 will put our words and our dollars behind strategies designed to keep our communities safer. And it does this by supporting the work of trusted community partners and experts. There are existing units in each of the state's attorney's offices that are appropriate and effective places to use these funds and to allocate these grants. And they, in the legislation, will be making the decision about what programs would be most impactful. Also, this bill requires or allows or sets forward that they would establish the procedures for the application. Also, it's requiring that we have clearly defined and measurable reporting guidelines for the applicants. So I'm recommending these funding levels in this bill, but we're not creating new programs. And this bill was the cross file is actually the initiator of the bill. in the House, and we were talking about the similarities and challenges our jurisdictions face and decided to go into this together. We both believe that the state can do much more to utilize a holistic approach to reducing both property and violent crime. And there will be accountability as the organizations receiving funding are required to abide by the reporting requirements of the Governor's Office of Crime Prevention, Youth, and Victim Services. So colleagues, when we look at this year's budget, our FY23 budget set forth by the governor, the Baltimore City State's Attorney Law Enforcement Grant is allocated or is recommending an allocation of about $1.7 million and about $1.1 million for the state's attorney's office at Prince George's County. Each state's attorney's office obviously gets an allocation for the state, and this law enforcement grant is one of them. Additionally, there's an $8 million set aside for Baltimore City and $23 million for Prince George's and another 100 or so million for each of the 23 jurisdictions for the state aid for Police Protection Fund. The State Aid for Police Protection Fund is formula-driven funding, and it's used to supplement resources for police protection in our local communities. It supports the operating budgets of our local police departments, and it provides them with this additional much-needed revenue, some would say. So it's about $125 million for this line item alone. So together, there's about $200 million in direct support for law enforcement and $125 million for, direct support of our state's attorney's offices, and then another $125 million for support of our law enforcement agencies. So voting in this context, voting for SB 106 would say that the state is willing to spend an additional $1 million on prevention. That's about 0.005% of the money that we're currently going to agencies, the state agency, and directly to our police forces on enforcement to spend this small percentage, this ounce, if you would say, focusing on prevention strategies of youth. So it is truly that ounce that makes our community-based partners. They need this to help make our neighborhoods safer. So with that, colleagues, I ask and respectfully ask for your favorable report of SB 106.
Thank you, Senator Washington. We'll now move on to State's Attorney Aisha Braveboy. Aisha and I came into this assembly the same year at the same time. Who would have thunk we'd be here right now? Go ahead, State's Attorney Braveboy.
Thank you so much, Mr. Vice Chair, and it's great to be with all of you from the Judicial Proceedings Committee. I want to give a special shout out to Senator Jill P. Carter, who was a guest lecturer in my class last night, and she did a phenomenal job. So thank you so much, Senator. And to Senator Washington, thank you so much for sponsoring this bill. As you all know, we are facing unprecedented amounts of violence in our community. I don't believe in the last 20 years we've seen this level of violence. In Prince George's County, we have experienced a 21% overall increase in crime since 2019, which includes an 83.8% increase in murder and a 323% increase in carjackings. When we look at those who are committing most of these offenses, we're talking about young people, people who are under the age of 18 and those who are about 18 through 26. And so we call these individuals our emerging adults. Between our juveniles and our emerging adults, if we can reach them more holistically, if we can provide a pathway to their future, which does not include criminal activity, we would all be much safer. I think the state's attorney's offices, we sit in a very unique place. Certainly, we're part of crime prevention, and we certainly will prosecute those who commit offenses in our communities, but we are also problem solvers. And so what we recognize is that we have to work within the law to address problems in our communities. And what we know is that we can't do it alone. We need the support of nonprofits. I would not be able to move forward with initiatives in my office, but for the nonprofits who are willing to partner with me. Unfortunately, I am unable to, provide them with the much needed grants and resources that they need in order to increase their capacity and provide more services for more people. If I could just finish up. So sorry. We launched an Our Streets, Our Future initiative in response to the gun violence, and many of our community partners responded. So we have a number of them who are on the line here. I can tell you that they provide job training, job placement. We have individuals who you'll meet today who provide services for people who are incarcerated. So these are people who are in prison now. We want to expand those programs so that we can ensure that people don't come back out into our communities and continue to commit offenses. The money we get from the state really just pays for our staff. So if you hear about grants that state attorneys' offices get, we get those grants, at least in Prince George's County, to pay for employees. That does not it does not go to pay for, and it can't, based on the criteria for those grants, go to pay for nonprofit support that we need for our office. And that's why this money is so critically important as we do all that we can to prevent gun violence and crimes in our community. And I ask for your favorable consideration. Thank you very much.
Thank you, Madam State's Attorney. We appreciate your testimony. Next, we'll go to Yusuf Ahmad from the Baltimore City State's Attorneys Association. I apologize if I mispronounced your name.
You're fine, Mr. Vice Chair. Good afternoon, members of the committee, Mr. Vice Chair. My name is Yusuf Ahmed, and I'm the Director of Legislative Affairs for the Baltimore City State's Attorney's Office in support of SB 106, which would allow our office to provide funding for programming to nonprofit organizations with the goal of violence prevention and community service initiatives in mind. My team and I oversee the management of our grant funding in our office that we primarily receive through the Governor's Office of Crime Prevention, Youth and Victim Services, as well as the federal government. As Madam State's Attorney just noted, the majority of these funds cover our staffing costs. We have been able to stand up a few community programs with the grant funding that we've received. I'll touch on those in a moment, in which we partner with our local nonprofit partners in our local schools. Our team has successfully applied for, manage, and maintain our level of funding year over year, but it has been difficult to do any long-term planning as by its nature, grant funding is not a stable source of funding for the long-term planning. Having appropriated funding within the governor's budget would allow us to achieve those long-term plans and goals. We're confident in our office's ability to properly manage this new pot of money, submit our necessary oversight documents to the governor's office, as we have and will continue to do on our existing grants on a quarterly and annual basis. Some of the programs that we've been able to stand up in our office with the grant funding that we have is our Project 17 program, which partners with local schools to provide monthly workshops and resources to help students achieve academic excellence, reduce truancy, and earn practical work experience. We've been able to partner with local organizations and nonprofits to provide students with employment opportunities in exchange for improvements in their attendance and academic achievement. We've also been able to work with local organizations to run our Great Expectations program, which reaches children at the elementary school level to provide interface and positive careers in the criminal justice system with the goal of nurturing their potential interest in those careers. These are the types of programs, among others, that we would hope to see the community apply for upon time. Okay, we ask for a favorable report. Thank you.
Thank you so much. Next on our list is Mr. Jason Tisdale. I don't see Mr. Tisdale in the room here. We'll go to Tanisha Miles. Ms. Miles.
I'm unmuted. Good afternoon. Thank you, Vice Chair, for giving me the opportunity to share. My name is Tanisha Miles. I am the founder, President and CEO of P31 Girls Incorporated, located in Prince George's County. And I'm excited about this opportunity to see that we are now putting the needs of our community on the front line. There are many needs in Prince George's County, and I've had the pleasure of partnering and championing some of State's Attorney Aisha Braveboy's vision in helping our youth, diverting them from the criminal justice system. And we've been able to do that through weekly wellness checks. We've also partnered with Prince George's County Schools, and we're able to work within the school system to help our young people with academic coaching and mental health support. In addition to, we've been able to offer internships and scholarship program that we're really excited about. So we're doing some great work in the county, and it is very difficult when you don't have the funding. And one of the things that's been mentioned over and over again is that there are a lot of passionate organizations, very skilled, very knowledgeable, but we don't have the funds. And so this would really allow us to expand our capacity and our reach, specifically P31 girls. We serve young ladies from the age of 11 through 18. Again, we have our program that we run with State's Attorney Aisha Braveboy's office, and we also are working with students inside the school system. And so this is just a great opportunity. I am in favor of this bill. I hope that you all take it under serious consideration, because we have a great opportunity to make a difference in the lives of our young people by offering them the support at an early age. We don't need to wait until they're incarcerated. There is an opportunity to intervene and to divert them at a young age with strong programming, support, and services. And I just want to thank you for the opportunity to share.
Thank you so much. Next is Rhonda Dallas. Ms. Dallas, you're up.
Okay, now I'm unmuted to quickly respond. Crime prevention and sustaining the safety of our residents and visitors require an all hands on deck approach. And through my experiences leading the Prince George's Arts and Humanities Council, I know the arts and nonprofit collaborations can play a vital role in the solution. State's Attorney Braveboy and her team and members of my team, we began crafting an outdoor mural program that supports preventing gun violence, vandalism, and tagging while promoting community safety and beautification of Prince George's County neighborhoods. Commissioning one of the most prominent local community artists to assist in this new program, our focus would start at the top priority neighborhoods identified by the State's Attorney's Office and engage youth and young adults in at-risk environments and who are at risk of involvement in illegal activity. Impactful programs such as this are proven models across the country, providing measurable outcomes such as core skill building, but essential to their success is sustainable funding. And SB 106 will ensure resources to launch such collaborative programs and ensure our streets and our future are secure. So I thank you for this opportunity to speak and the favorable consideration of this legislation.
Thank you so much. Next, we'll go to Kalila Denny. Ms. Denny.
Thank you. Kalila Denny with the Denny House Incorporated. I thank you all for allowing us to come into speak today on behalf of this bill. We are in favor of SB 106 and in favor of the State's Attorney's Office being awarded funding to support the nonprofits that are supporting the great work that she is doing. The Denny House provides mentor and tutoring services, expungement support for returning citizens, as well as community engagement and community outreach opportunities for those who are in need of support. So access to opportunity is vital for our young people. That is one of the things that is so often keeps them from succeeding. And when you have nonprofits such as ours who are out doing the work, who have been doing the work in the community, it's hard without the funding that we could be receiving through this bill. We do our very best with what we are given, and we accept the charge and are on the front lines with the state's attorney and her office in support of reducing the gun violence in our communities and other violence in our community. And it would be much easier for nonprofits like the Denny House to do that work if there were funding that was designated directly to support that work. So thank you so much. And I am in favor of SB 106.
Thank you, Ms. Denny. Next on our list is Michelle Hare. I don't see Ms. Hare in the room. We'll move on to Ramon Jackson. Mr. Jackson.
Yes, good afternoon, everyone. To the Vice Chair, the honorable members of the Judicial Committee, and to Senator Washington. My name is Ramon Jackson, pastor and founder and director of the One Love Life Center. We specifically deal with young people by providing them resources to better themselves, mental health, and opportunities for mentorship. Partnering with entities such as the State's Attorney's Office of Prince George's County is critical and necessary. Providing funds such as those that will be provided by this Bill 106 would allow initiatives like Our Streets, Our Future to assist in providing ample opportunities to the necessary means of critical and fundamental resources that would help young people avoid the pipelines to jail, the pipelines to prison, and it would aid families who benefit from resources like this to avoid the hurt, the grief, the despair, and oftentimes the death that ends because of violence that stems from the lack of resources, from things like carjackings and things like armed robberies. I've partnered with the State's Attorney's Office on several initiatives. I've worked with young people most of my adult life. I've seen what happens when the community unites to provide love, guidance, and support to our citizens. This bill would enable us to host more community events, establish supportive programming, and continue building viable partnerships that would enhance the viability of our communities. I hope, ladies and gentlemen, that you will give the utmost attention to this bill and pass it so that we can do the work that our community so deserves. Thank you for your time.
Thank you, Pastor. Next, we'll move to Latasha Ward. Ms. Ward, you are up.
All right. Good afternoon, everybody, and thank you for the opportunity. My name is Tasha Ward, the Executive Director and founder for the Silent Foundation. I'm in support of SB 106. Definitely, love working with the State's Attorney Office. Had the pleasure of participating in several expungement events that allowed, people, the baby, to have access to opportunity. So, funding definitely, is crucial to be able to help get people back on their feet. My program, concentrates on entrepreneurship. A lot of times, people think maybe everybody's gonna go to college, but, that might not be the key, but we help people start their business from start to finish, and definitely having funding to do that will definitely give a young person hope and a better future. Yeah, so definitely I'm in support, and I echo everything else that everybody else said. Having the money will allow us to be able to continue doing the work to make a difference in a young person's life.
Thank you for your testimony, Ms. Ward. Next on the list is Derek Fenner. I don't see Mr. Fenner with us. All right. Philip Lee is on the list. Mr. Lee, you're up.
Good afternoon, Mr. Vice Chair, committee members. I am Phil Lee. I am the Executive Director for the Community Public Awareness Council, better known in Prince George's County as CPAC. When the State's Attorney advised me of her intentions to submit the proposal for this legislation, SB 106, there was a sigh of relief and a feeling of hope. I thought finally we will be able to organize, there will be organization of the community-based nonprofits and a process to bring the needed resources to our youth and families that are in various and risk categories, at-risk categories. With the passage of this bill, the State's Attorney will be able to address the direct resources with the means to do so to those in need, and with the needed oversight to ensure progress. CPAC has been on the ground in our communities for 20 years. We have forged partnerships with our schools, our law enforcement agencies, and most of all, the parents of our youth. Our diversion program is designed to hopefully one day shut down that schoolyard to prison pipeline. With our programs, we have diverted more than 5,000 of our youth away from the files of the criminal justice system. We have moved chronic truants from the streets of our communities to the graduation ceremonies of our schools. We have resolved family crises by way of conflict resolution and have worked to develop real working police-community relationships. We have done these things over many years on what amounts to a maybe kind of budget. Many of us use our own household budgets to get the work done. We do need your help. The state's attorney, who I must mention was CPAC's general counsel for 15 years, we did pay her $1, knows what uniting organizations with proven track records will accomplish. She knows because she has been a part and member of the process. Grant her what she needs to continue this work. Grant the state's attorney the passage of this bill so we all can do more for more. Mr. Vice Chair, I thank you and the committee for granting me this time to speak on behalf of the youth and the parents of Prince George's County.
Thank you for your time and testimony. That's it for the proponents of the bill. We have a couple of people testifying for informational purposes only. We'll take questions now. Senator Carter.
Thanks, Mr. Vice Chair. Thank you, Senator Washington, for bringing the bill. And of course, State's Attorney Braveboy for taking this holistic global approach to justice outside of just prosecution and conviction rate being your goal. So my question may sound troubling, but I hope not. The first thing, two quick questions. Senator Washington, a couple of years ago, you supported legislation that we got passed in this body for violence intervention and prevention programs that are evidence-based, and those programs are go through GOCAP, and then there's a special committee that I'm on, the VIP committee that assesses these groups for, it's been slow to move, slow to get off the ground. I think it's making a little bit of progress years later. So do you see this as kind of an expansion of that, or why the need for this outside of that?
Well, first of all, it was a cross file with Delegate Barnes. But also I was attracted to it specifically because the money is centered in these law enforcement agencies. And when I researched how much the state is already investing on the enforcement side, and I added up and looked at what were we truly doing on the prevention side, I saw that there was a huge misgap. So this, I would hope, would work in concert with. I would actually believe that we need much more. But I don't see this as in conflict. I think there's a very specific programs that seem to be operating within state's attorneys' offices, and they need more money.
So now for my more controversial question.
Oh, I thought that was the controversial question.
In no way is this an affront to the goal here, and certainly can't say enough about how much I respect the goal and State Attorney Braveboy. But that being said, I'm wondering about the efficacy of, first of all, and salute to all of the programs and organizations that testified in the wonderful work that you do. I want to make it clear, I'm fully supportive of that. I'm wondering about the efficacy, though, of having it the sole source of funding through the state's attorney's office. And of course, in my mind, in my heart, I'm thinking, you know, our public defender's office are close to the other side, and they represent the people that are accused of crimes often and deal with families on a whole different level. So what would you think about maybe having some collaboration with the public defender's office with respect to these grants?
This bill belongs to the committee, and I'm offering it, and certainly I think, you know, if you're open to that, or maybe that's another bill, or but I don't see any of this as saying that one agency is better than another. There just was a gap, and I just sought to support efforts in Prince George's County, and since I saw that that was very similar to what I see are the needs in my own jurisdiction, I brought ours on board as well.
Thank you.
Thank you, Senator Carter. Thank you, Senator Washington. We'll next move to Senator West.
Thank you, Mr. Chair. The bill is great. I will say that as Senator Washington was presenting it, my eyes were glazing over with dollar signs. And that's because, frankly, this bill needs to be in B&T, not in JPR. We don't have the power, I don't believe, to pass a bill to the floor which would require mandated appropriations of dollar amounts of money in the governor's budget in the future. At the very least, I think we would have to seek approval from B&T to pass such a bill. And if I'm at B&T and I get a call from JPR saying we'd like to pass this bill, I'm going to say, well, what is it for? And probably I'm going to be told, well, you need to watch our hearing because the hearing tells you what it's for. I'm not sure why it got assigned here in the first place. Senator Washington, have you a clue as to why this bill does?
No, I was surprised, but I was happy because you all know, I mean, frankly, you from a policy, we have this, all the policy decision committees have this. We know the needs. And frankly, I do believe that we are well positioned to be able to make decisions about allocations. Again, this is not a lot of money in the big grand scheme of things. But yeah, I had nothing to do with guiding it to your wonderful committee.
Thanks for your answer.
We like having you back in JPR, Madam Senator. Senator Hedelman.
Thank you so much, Mr. Vice Chair. I don't see it as being so unusual. If I could just follow up my colleague's question, and I have a bill coming up that is also going to deal with a mandatory appropriation. I think as having served on a budget committee before, it happens all the time and they collaborate. So that doesn't bother me, but I do think this is an important legislation. I would just like to know, similar to what Senator Carter discussed, kind of how you landed on state's attorney's offices as being the vehicle through which these grants should be provided. I think that there is like a lot of research that shows that we need to boost the capacity of community-based organizations in order to be able to effectively fight and deter crime. So I think this is 100% in the right direction. I'm just sort of curious as to why the vehicle of the state's attorney's office. I mean, I have to say, I'm happy to hear that so many of the organizations have already existing relationships with the state's attorney's office. So that may be why, but I kind of wanted to think, I wanted to ask you, what was the other world of avenues that you considered?
I will say that the only avenue was this, in terms of understanding that these two specifically these are state agencies invested in as part of our law enforcement infrastructure, and that I did not see it in contradiction to anything else. So again, if this committee wants to add other agencies, want to add more money, I certainly would support that. But the fact that there are already existing programs in each of these offices that are woefully underfunded and over the years have actually been defunded, I felt like it was appropriate to start with these two. So it's not in contradiction to any other agencies. I absolutely believe probably that all of them should get an additional 500, but these were two agencies that I was aware of that there was already work, and you saw testify that there are a lot of nonprofits that are already volunteering or making it work. And if we could support the work of our community partners, the trusted partners in the community, that I think that's something we should be invested in.
Thank you.
Thank you, Senator Hedelman. Senator Casserly.
Thank you, Mr. Chairman. I really sort of a follow on from Senator Hedelman's questions about placing this block grant, what amounts to a block grant with the state attorney's office. And I can't speak to State Attorney Braithwaite's office, but it certainly occurs to me that one of the problems that the Baltimore City State Attorney's office has is that they're focused on everything except for the prosecution of crimes. And this is only going to further the dilution from the concentration on doing the mission at hand, which is prosecuting bad people and protecting the public safety. So, and to suggest that state attorney's office has some innate knowledge about how to decrease crime just seems like it's a stretch too far. We've even got a state attorney there who's declined to prosecute the laws that we pass. So why we would reward that? This is my question, Senator Washington. Why do we want to reward a state attorney, a constitutional officer, who has stood up and publicly said, doesn't matter what you do, I'm not prosecuting. These are no longer crimes, regardless of what the General Assembly has said, regardless of my constitutional limitations, that I've decided that I am the super legislature here and I'm not going to prosecute. Why would we reward that kind of behavior by issuing that state's attorney a block grant, over which we have very little visibility, and not simply give that, if, you know, again, I share Senator Hellman's concern that yeah, we do have to do things besides just prosecute, and we do need to pursue other avenues. But why would we give that to a state's attorney and not to a city council or a mayor, someone who already has large offices set up to evaluate grants, grantees, monitor effective expenditure of the public funds, et cetera?
Yeah, thank you for that. And thank you for an opportunity to just sort of respond to that point of view. I see this as just like our offices, like you are not the 43rd district is not Senator Mary Washington. So whoever serves in that position is not the position. And I'm not going to respond to your statements because I don't think they're appropriate in this context. And however, we fund offices and it doesn't have to do with the individual that is serving. We either are supporting the work of a Baltimore City State's Attorney or the work of a Prince George's State's Attorney or the work of a Harford County State's Attorney or not. And so that's my response there. Additionally, as I have said a couple of times, I noted you were on and off. I don't know if you were on a phone call or something, but that there are existing programs and grants already being managed in each of these offices. So they already have grant managers that are separate from the law enforcement operations of each of those offices. So one would just reject the idea that one can't prosecute crime and also attempt to prevent it at the same time.
Okay, it's a difference in philosophies.
It is clearly.
And yeah, I think it's unfortunate because it's there's clearly a major failure in law enforcement, and
right.
And we have no common view within this body, the General Assembly.
Well, can I just, again, I don't, let's not just say that I just testified. And when you open up the governor's budget and you open up even the budgets of our own city, Baltimore City, there's significant investment in law enforcement. And I think I noted that there's less than 1% of investment in any type of prevention in the budget. So well over hundreds of millions in enforcement. So Senator, it is simply a misdirection and a lie to say that this General Assembly has not voted year after year to make significant investments in law enforcement and addressing crime and supporting our police officers and our law enforcement.
That's not what I said.
That is absolutely what you
all right, guys.
Okay. So thank you. I'm sorry, Mr. Chairman, but this is, this is about helping young people stay out of jail.
But that's okay.
I responded. I guess we'll probably have another opportunity.
Thank you both.
Thank you.
Normally we do one question, one answer.
I know, sorry.
But I did want to give an opportunity to Mr. Ahmed from the Baltimore City State's Attorney to respond briefly, Mr. Ahmed.
Yeah, so Senator Cassidy, I think this is a philosophical difference that we won't be able to hash out now. You and I respect each other. We've worked together on witness intimidation legislation. I will say that the governor's office, we receive millions of dollars of grant funding from the governor's office, of which we provide quarterly performance reports to their office, to Glenn Fuston's office. And in addition to annual reports, we also just had a larger audit of all of our grant performance data in December, of which they seem pleased with the data we provided, and funding has not stopped. So if you would like to talk to me outside of this hearing, and we can provide some of the data to you as well, or we can hash it out there. We can handle it that way, but I just wanted to share that with you.
Thank you. Senator Watson has a question.
Thank you very much. I don't want to get into the nuances between what Baltimore does and what Prince George's does, but I do want an opportunity for Mr. Lee and County State's Attorney Brave Boy to speak to a little bit more about the diversion. I've had an opportunity to visit Mr. Lee's program. I've had an opportunity to talk to the students that he brings there who were diverted there by principals within Prince George's County. And I think that the state's attorney is in a unique position in what she does in Prince George's County as being that interface and being able to help steer those kids who would otherwise be in major difficulties into like a last opportunity to get them straight before they go on a road to nowhere. So I'd like, either Mr. Lee, who runs one of the programs that I'm very familiar with, and I appreciate his invitations in the past, or Attorney Braveboy to talk a little bit more holistically, how it's not just her decision, but she works with the various principals in the school district and those folks in the school to ensure that those kids are properly diverted to these programs and give them every opportunity to exceed, if you don't mind, Mr. Chair.
Please, Ms. Braveboy.
Well, thank you so much. So I'll start and then pass it over to Mr. Lee, but I would like to say that, the state's attorney's offices, we are state constitutional offices, which is why I think that Delegate Darrell Barnes, who is the House cross-file, decided to place this responsibility in our office. In addition to that, we, as you can already hear, we already coordinate with a number of nonprofits in our community because we understand that as a part of the crime fighting strategy is prevention. So prevention is extremely important and we can't underestimate it, not just preventing the first crime, but oftentimes preventing the second and or third, because oftentimes crimes escalate in terms of severity. And so working with nonprofits is critical in that. And I think the state's attorney's offices are in just a unique position to really see not only the justice system, but also what's wrong in society. Because we are elected members of our community, we travel throughout our community constantly. And so we know where the areas where there are issues, concerns, we know where there are breakdowns in families and in education. And what we do is we attempt to ensure that our communities are safe. Mm-hmm. We have to treat each and every person in the justice system fairly. And if we know that there are issues with homelessness, if we know that there are mental health issues, if we know that children have been neglected, then we can't simply just focus on prosecution every single time. Because prosecuting someone with a mental health issue is not going to improve their circumstances, nor will it make our communities safer. And so that's why I think that it is important for the state's attorney's offices to be invested certainly in prosecution, and we do that very well. I think what we have not been funded to do is deal with the other issues that occur that impact the justice system. And so working with partners like Mr. Lee, who you'll hear from, we're able to take, especially young people. Now we're talking about in his program, young people who are in high school. And now we have started to transition him to, some, we call it emerging adults, those who are a little bit older, who've committed some offenses, not necessarily the felony offenses, but misdemeanor offenses, still significant. But some of them are homeless. Some of them have substance abuse issues. Some of them, just because you turn 18 doesn't mean you don't have the same needs that you had when you were 16 and 17. So there has to be a way for us to work with people who are in our communities who need additional support that the schools aren't providing, and that, the criminal justice system certainly cannot provide. And so that's why partnering with these nonprofits in our community is so critical. And I think we're in a great position to do that. I think Ron had a question. Oh, sorry, Senator Watson had a question for Mr. Lee.
Yeah, Mr. Lee, usually we do one question, one answer, but if you have something brief you'd like to add, please feel free to do so.
I think, of course I would, and I want to thank Senator Watson for giving me this opportunity, because it's difficult to really talk about what we do in 2 minutes when I have to try to write it down. I'd like to say to all of you, when you talk about how much funding you give to police officers, I would invite you to come and talk to some of the police officers who work directly with us. We're able to lessen their load. We're able to take a young person off of their hands that they do not want to arrest. It's important. We understand what our schools are dealing with. We don't, and we cannot ignore that we have parents who simply cannot manage. But those children, they go to our schools. So if a principal calls me because there's a child in need of some kind of assistance, we step in because there's nobody else there to do it. Now, one can say, well, she could call social services, and well, no, she can't. And that's not always necessary. We try desperately hard to find another way instead of introducing our children to the system. And when we do that, we help everybody. So the money you give to the schools, the money you give to the police department, the money you give to the state's attorney, we help that money to go further. I want to say this. I live in Prince George's County. I don't live in Baltimore City. Why our state's attorney and why this program that she has decided she needs to find a way to fund? Because she has done this work before. She's done this work when she worked in the community. She knows what we're up against. So I would say to you all, we are fortunate enough to have a state's attorney that understands what the police do. She understands what the school teachers are up against. Senator Watson said to you, he has come to our youth center and he has sat there, and I've watched him as he looked around in surprise, because we do make a difference. People who do what I do, please don't think that 25 years ago, I decided, okay, I'm going to retire and I'm going to start helping at-risk youth. No, I didn't. I saw the need. And so what do we say? We cannot expect government to do everything. Right. But I should be able to expect government to help me help them. I can't keep spending my money and have my wife looking at me like I've lost my mind, or my tax consultant saying, wait a minute, something's wrong with this, because the government does not see what we're doing as being necessary. If we were not there helping your service people, the question would be, if not us, then who? You're going to hire more police officers? You're going to hire more teachers? You're going to hire more social workers? No, you're not going to do that. You have people like yourself who are willing to volunteer their time to help you. I don't do this to help myself. I do this to help all of you. But you cannot expect me to keep paying for it. I will give everything I have. But I think that we are within our rights to say to our state legislators, give us some help. We are trying to help you. This is not about us. There are no walls between our community. There are no walls between Baltimore City and Prince George's County. I deal with carjackings every day. I have a 12-year-old in my program. His mother cannot spell carjacking. The police say we cannot keep arresting this boy over and over again. Somebody has got to help. Should we lock him up? Should we make him a commodity of the state? No. I used to be that 12-year-old. I've spent my entire life in law enforcement because somebody who did not have to stepped up and took me by the arm and said, there's another way to go. I say to all of you, trust me when I tell you, we know what we're doing, and we know what we're doing is necessary work. I would say to you, everybody take a look at Prince George's County, look at what we are doing here, look at what we want to do here, and then help us to get that important work done. That's all we want.
Thank you.
We're not asking you to give us anything. We're asking you to help us help.
Hello, can you hear me all right?
Thank you so much, Mr. Lee, for your passion and your testimony. Seeing no further questions for the proponents, we'll go to Mr. McAvoy, who signed up for informational purposes.
Great, thank you so much. I appreciate it. Committee, I've got the other judiciary I got to jump into, and I got to mute them. There we go. I apologize for that. Just a little background on this bill briefly for the sponsor, for those who spoke, and for your committee. It appears that Public Safety Article 4-102 already has 360,000 set aside for this. So I guess it would be a rounding error to say to take it up to 500,000. But that said, what I wanted to introduce is something that we've talked about for about a decade, which is that the presence of fathers in children's homes make a difference in the output of crime. Now, some of you know that I used to work for child support system. I'm sending you a map right now. And if you look at child support and you look at the crime levels that we have in the city, and I cannot speak to PG County, you see that correlation. And what I'm asking you to do is, though I don't do this, I'm not involved with a program, nor do I ever monetize what I do, but I think it's vital that you have a fatherhood advocate that's getting some type of grant money, some type of part of implementing this. If you look at the sponsors on the other side, we know that Daryl Barnes, he actually does this kind of mentoring in PG County and has for years. We have other delegates who are familiar with it in the Baltimore area that are on the cross file. So what I just want to do is encourage you to go that route. There was a study put out in 2021 discussing the issue of fatherhood absence. And so to Aisha Braveboy's point about what's wrong with society and breakdown of family, looking at this from a prism of fatherhood and crime reduction could be a benefit for all involved. And that can translate into lower crime rates, lower violence, crime prevention, that we're being proactive about these issues. You have the map, you already know. I just want to tell you anecdotally, when I was at child support 2 years, we had basically 3 zip codes that kept ringing over and over and over. That's where you have the crime.
Thank you, Mr. McAvoy.
Hope it helps. Thank you, Senator.
I appreciate your testimony. Seeing no questions for Mr. McAvoy, that concludes the hearing for Senate Bill 106. We'll now move on to Senate Bill 324. Senator Lee, you are up.
Okay, thank you, Mr. Chairman. This bill, Senate Bill 324, is one of 3 of the 2-party consent bills that I'm sponsoring this session. This should be completely common sense type legislation. It's non-controversial, and I don't believe there's any opposition to this particular bill. The bill simply amends the violation of the 2 consent intercepted communications law from a felony to a misdemeanor. As you know, 38 states, they have a 1-party consent law, and remaining states, they all have some sort of exception to cover emergency situations. But in Maryland, you are a criminal and a felon if you do common activity with modern technology, such as using a cell phone, which is to audio record someone in a private setting without their consent. That's currently a 5-year felony in Maryland, and it's not only puts defendants in an impossible situation, but it discourages victims from coming forward with evidence of their abuse or any other like crimes of violence. Another bill you will soon hear creates exceptions to the 2-party consent rule for Maryland for serious crimes that are occurring. But this bill simply removes that felony label from the existing crime with a penalty of up to 5 years imprisonment. While the sentence could be for less time, the label of felony has certain collateral consequences, as we will hear from the witnesses, even if there isn't an underlining convictions. Maryland should not force plea deals because our laws have draconian penalties. That is, to me, not justice. SB 324, it's just a small move towards common sense, but it also highlights how other laws in this area have not caught up with the technological realities of the 21st century. Our intercepted communication laws arose just for historical purposes, during a time when there was limited technology and very dirty political games being played at all different levels of government. Oppositions and rivals of local and state officials were taped and blackmailed with the results. President Richard Nixon had installed in every governor's office a 1 way device that allows surveillance of state executive offices. And of course, at that time, the technology was sparse. No one knew about it, but it was in advance. It was expensive and not contained at your local grocer. Today, recording devices are ubiquitous with daily life and cheaper than ever, and access to another's electronics are just very common and every day. Likely you or your staff leave a cell phone or computer logged in throughout the entire day. Maryland is only a handful of states in which the interception of communications is a felony. It's time to bring our laws into agreement. Surveillance and recording of a minor in private setting with pure intent remains a misdemeanor. Yet, if a person saw a recording of a minor sent to their coworker's phone, intervene by forwarding the recording to law enforcement, they could potentially be charged with a felony. Please make this common sense legislation a reality. We have to change our laws to adapt to modern life and modern technology. No longer are we so removed from recording technology that exists only in the realm of party machines or dirty politics. Still, I want to encourage the avoidance of intercepting communication, but it's time to reduce the charge. This bill has encountered, as far as I know, no oppositions. For these reasons, I respectfully ask my colleagues to vote favorably on this bill. Thank you, Mr. Chairman. I'll turn it over to my witnesses now.
Yeah, thank you, Senator Lee. Appreciate your testimony. We'll now go to Mr. Burdette. Jake Burdette, please turn on your camera and you're welcome to begin.
Hey, I'm actually calling on from my phone and reading off my phone, so I can't turn my camera on, if that's
fine.
okay.
Go ahead.
Yeah, okay. Good afternoon, Chair Smith and members of the Senate Judicial Proceedings Committee. My name is Jake Burdette, and I'm testifying today in support of Senator Susan Lee's bill, SB 324, which would make Maryland's interceptions of communications penalties a misdemeanor rather than a felony. This is a bill that is very important to me personally because Maryland's current archaic and overly punitive wiretapping laws have negatively impacted my life in a major way. More specifically, I was in a very high profile and controversial case in 2018 during my time in college at Salisbury University, where notorious Maryland Congressman Andy Harris pressed felony wiretapping charges against me for live streaming a protest at his constituent office without the consent of his staffers. Despite widespread bad press resulting from this authoritarian move, I was still facing a potential 10 years in jail for this, as well as 2 felony charges. Although I was able to avoid any jail time by taking a probation before judgment plea deal, and I was not actually convicted of any felonies, just having the felony charges on my record at all has continued to follow me around for my young adult life and make it very difficult for me to find meaningful employment, and has also served as a scarlet letter on my reputation. Unfortunately, there's a lot of stigma around the label felon. So as I've learned the hard way, many employers just outright reject any potential applicants based solely on having any felonies on their record, regardless of what the felony even is. This is often done through automated background checks, which reject applicants even if all they have is a felony charge but no conviction. Because of my felony charges, I faced hiring discrimination from employer after employer for jobs I was qualified for. And as a result, I had no choice but to work in an Amazon warehouse during the height of COVID, as they are one of few employers that did not do background checks. It's a shame that the label of felon carries so much negative weight in the eyes of society and employers at large. And as long as that's the case, I think we should reserve that label for only the most heinous of crimes like murder, rape, and other truly abominable acts. But I don't think live streaming protests. Thank you for the testimony.
Thank you for your testimony. We'll now go to Ed Fishman. Mr. Fishman, you are up. Please turn on your camera.
Thank you, Vice Chair Waldstreicher and the members of the committee and Chairman Smith. For the record, I am Edward Fishman, and
Mr. Fishman, I believe you may have muted yourself here.
my apologies. I hope I get my time back. Can you hear me now?
Fishman.
Okay, yes. For the record, I'm Edward Fishman. I sit on the State Steering Committee for Our Revolution Maryland. This case, this legislation rises out of the injustice which was visited on a member of our group who faced felony prosecution for merely live streaming during a public protest. I believe the prosecution was based on a misreading of the statute as to oral communications, which are defined in the preceding section as, quote, private conversations, close quote. The protest by multiple activists was always meant to be a public display, one protected by the First Amendment, recording public conversation and events, as Senator Lee indicated, is the currency of activism these days and journalism. It's jarring to consider that might be charged as a crime, much less a felony. And yet, rightly or wrongly, Mr. Burdett was charged. His case exposes both the potential for politically charged prosecutorial abuse and the pressures he felt to accept a plea for probation instead of risking trial for felony charge. The public interest would best be served if the legislature amended the statute to more clearly express and protect our rights to record and broadcast public events. Still, future defendants may benefit from a reconsideration of the penalties here. This conduct isn't even criminalized in over 40 states, neither felony nor misdemeanor. There's no justification for maintaining the current felony classification in Maryland statute. If another prosecutor uses their authority for a similar political prosecution in the future, perhaps that defendant, freed from the threat of a long prison sentence, will be willing to fight the injustice and litigate the free speech issues involved. For that reason, I ask for a favorable report on SB 324, reducing the Section 10402 violation to a misdemeanor.
Thank you, Mr. Fishman. Questions for this panel? All right, seeing no questions, that concludes the hearing on Senate Bill 324. Looks like we're going to stay on this topic. Senate Bill 326, Senator Lee.
Can you hear me now?
I can.
Okay, thank you, Mr. Chairman. This is SB 326. It's a response to a specific incident where Caroline County Circuit Court judge was caught videotaping young boys, and while he committed suicide, it was unclear if he would have been prosecuted beyond a maximum penalty of just 1 year maximum sentence misdemeanor. The punishment here certainly does not fit the crime, and while the crime was horrific enough for the judge to take his own life, under the laws of Maryland, it is 5 times less serious than intercepting any audio communications. And unlike that crime's penalty, it's not currently a felony. While a felony for intercepting an audio communications without consent is unreasonable, a misdemeanor for videotaping sexually explicit images of children is also unreasonable. Currently, the surveillance and recording of another while in a private location somewhere who has a reasonable expectation of privacy, such as a bedroom, bathroom, changing room, locker room, is a misdemeanor with a maximum sentence of 1 year or $2,000 or $2,500 fine. This covers surveillance of anyone to include children. So a person who purposely sets up a hidden video recording device in a child's bedroom and records the child changing clothes or disrobing after a bath receives only a misdemeanor. An adult who deliberately uses a camera to view their junior high age neighbor's bathroom window receives a $2,500 fine. Similarly, an adult can currently use a hole to view into a locker room while teenagers changing their clothing, record a children's store, dressing room, and face 1 or 2 minimal outcomes. This bill just merely seeks to protect our youngest while elevating the charge to a felony with a maximum sentence of up to 10 years and increase the potential fine to up to $5,000 and allow for both the sentence and the fine if the subject of surveillance was a minor and the one surveilling the minor was at least 4 years older than the victim. This surveillance must be of a prurient or sexual nature and does not make criminal and unintended or momentary glance. This bill is also for victims of such recordings and intrusions into their privacy during their sensitive years. Children and teenagers already face enough today, finding if you have been recorded and someone is viewing you at a time when your privacy was expected, possibly with the intention of spreading images all over for the world to see online. That's very devastating. and invasion with the possibility of lifelong damaging consequences. And the victims of such invasions should know that we take this violation very seriously and see it for the ugly reality that it is. For these reasons, I ask my colleagues favorable vote on SB 326. Thank you. I'll turn it over to my panelists now and my witnesses. Thank you, Mr. Chairman.
Thank you, Senator Lee. We'll now move to State's Attorney Joseph Riley. Mr. Riley.
Thank you, Vice Chair, distinguished members of Judicial Proceedings. My name is Joe Riley. I am the elected State's Attorney for Caroline County and the Legislative Chair for the Maryland State's Attorneys Association. We seek a favorable report on Senate Bill 326. I'd like to thank Senator Lee for taking this important piece of legislation up to this committee. The purpose of this proposal is to address the disparity in the penalty for visual surveillance with pursuing intent and the harm it creates, particularly if the subject of the surveillance is a minor. As was previously mentioned, in 2021, Jonathan Newell, who was the circuit court judge for Caroline County, was investigated for secretly recording minor age males in various stages of undress at moments when privacy would be expected, such as showering at a cabin on a hunting property in Dorchester County. While the activities happened in Dorchester County, I was consulted because of the victims being Caroline County residents. The State's Attorney of Dorchester County and I were going through the possibilities of what to charge, and we were very concerned that there was a possibility that the most we could charge in this case was visual surveillance with pursuing intent, which is a 1-year statutory maximum currently and a misdemeanor. That in no way captured the harm that these young men went through. We hope that passing this legislation will begin to bridge that gap and actually capture the type of wrong that was committed and make it a felony and a 10-year, possibly punished by 10 years. We're going to hear a discussion about possible amendments to changing the language to make sure that it encapsulates private residences as well. We're certainly amenable to that as an amendment. So because we want to capture these people who are putting things in showers, changing rooms, anything that would be some type of surreptitious visual surveillance that we want to make sure is captured by this bill.
Thank you, Mr. State's Attorney. We'll move to Joyce King. Ms. King, you're next.
Good afternoon. On behalf of the Maryland State's Attorneys Association and the Frederick County Cyber Crimes Task Force, I'm testifying today in support of SB 326. I've been prosecuting child exploitation for 8 years, and this bill fills a wide gap in our laws to protect our children from sexual exploitation. I've had numerous cases of mothers' boyfriends or even random strangers surreptitiously placing cameras or cell phones to capture naked children in the shower, toilet, bedroom, or dressing rooms. I've watched these videos and seen perpetrators meticulously position camera angles to capture the children's genitals. I've reviewed computer forensics to show that these perpetrators then edit these videos, take screenshots for their collections. In all the child pornography cases I have prosecuted, I can unequivocally say there is a correlation between this type of conduct and the collection, production of child pornography, and even hands-on abuse. While I have previously been able to charge production of child pornography or even sex abuse of a minor in many of these cases, some of them still don't meet the nuances in the definition of lascivious display of genitals under the child pornography statute, or were not under the supervision or care of an adult for sex abuse of a minor. Therefore, visual surveillance with pursuing interest would be the best applicable charge, but a 1-year penalty is a gross injustice for this serious and predatory conduct on children. Even more concerning, last year, the DC Circuit in United States v. Hilly vacated a production of child pornography count in a case involving just this, the surreptitious recording of a minor naked in her own bedroom and bathroom. I don't have the time to discuss the details of that case, but I can answer any questions at a later time if any of the committee members have additional questions. But basically, the court restricted the definition of lascivious exhibition and therefore really just emphasizing the great need for this bill. There's a great disparity in the penalties of the current 1-year misdemeanor visual surveillance versus a felony child production charge when the conduct is nearly identical. So I strongly urge the committee to issue a favorable report of this bill. Thank you.
Thank you, Ms. King. We'll now move to Ms. Jordan. Ms. Jordan?
Thank you, Mr. Vice Chair, members of the committee. I'm Lisa Jordan with the Maryland Coalition Against Sexual Assault. We're also here in support of Senate Bill 326. I adopt everything that my previous panelists have said, but did want to specifically address the amendment that I believe the committee has and that the House Judiciary Committee is also looking at. And that is because right now, although bedrooms is listed in the statute, that's referring to a bedroom at a hotel or something like that. Residences are not considered private places where the statute applies. Therefore, there are many cases where you do have someone who is surreptitiously getting images through all of these means, but because it is in someone's home, this statute will not apply. So we encourage you to really look at that amendment and feel that it's actually as important in many ways as the changing the penalty for cases involving children. Regarding changing the cases involving children, I realize there's a lot of concern right now about raising penalties, about changing things to felonies. But in this situation, I also just wanted to point out that we are involving children and technology. And we actually changed the child pornography statute several years ago because that 1-year misdemeanor statute of limitations really doesn't give you enough time to analyze all of the technology. It simply takes longer. So when Ms. King or Mr. Riley, other prosecutors are prosecuting, they need to have their forensic experts have the time to analyze those materials. So changing something to a felony will have the effect of expanding the statute of limitations. This is also critical to prosecuting these really very, very disturbing cases. So for those reasons, the Maryland Coalition Against Sexual Assault urges a favorable report on Senate Bill 326.
Thanks, Ms. Jordan. Ms. Feinstein.
Thank you so much. Good afternoon, Vice Chair Waldstreicher and members of the Judicial Proceeding Committee. My name is Debbie Feinstein. I'm the Chief of the Special Victims Division for the Montgomery County State's Attorney's Office, and I'm here on behalf of myself and my boss, State's Attorney John McCarthy, and the Maryland State's Attorneys Association to testify in support of SB 326. As has been described by my colleagues, this is a necessary change to the law to really bring minors in these types of cases that really encapsulate a loophole, in a sense, into parity with other minors who may be exploited by adults. As Ms. King eloquently described, we have other crimes that cover some of the conduct. There are overlaps, but there are these gaps. I'm going to speak specifically to a case from my jurisdiction where we had a situation where an adult, a parent, brought their child to a gym. I can't remember if it was gymnastics or a cheerleading type of an event there, and set up, it was where they did their regular practices, and this parent set up in a backpack a camera in the girls' bathroom at this gymnasium. And he left it there. I'm not sure why no one noticed that it was there, but he would check it. He would change out his memory card so that he could continue to capture information, and observe, as Ms. King was describing, with a perfectly positioned camera to get pictures of smaller children, minors, genital areas. And in doing so, if he had been capturing pictures of his own child, he would be subject to sexual abuse of a minor, a felony that carries a 25-year penalty. Because these were children that were unrelated to him, not household members, not any children that he supervised, and given the nature of what the photograph looked like, they were not classified under the definition of child pornography. He only faced a 1-year charge for the visual surveillance of a person under the current misdemeanor statute with a 1-year penalty. This is a discrepancy that we really need to fix. As again has been described by my colleagues so far, when we're dealing with children, the penalty should be greater. This type of conduct should be rooted out. Unfortunately, these types, I may conclude, unfortunately, these types of crimes are a gateway to additional types of crimes, as Ms. King described. I urge this committee to support Senate Bill 326. Thank you.
Thank you, Ms. Feinstein. That concludes the testimony on this bill. I see the chairman has returned. Mr. Chairman, it doesn't appear that there are any questions for this bill, which would conclude our hearing for Senate Bill 326. I believe, Mr. Chairman, Senate Bill 375 is next.
Excellent. Thank you, Mr. Vice Chair. So we'll move on to Senate Bill 375. Senator Lee, you're up. Thanks, Jeff.
Am I unmuted now? Okay, thank you. Okay, thank you, Mr. Chairman. This bill, SB 375, is an important public safety exception to the current two-party consent law to ensure that our law keeps up with advances in today's technology. It corrects an imbalance that we have in Maryland's inability to protect vulnerable victims of violence and serious crimes. What the bill does not do is propose moving to a one-party consent. In fact, bills like this are perhaps the only way to ensure that we don't move to a one-party consent. But under our current Maryland law, victims of crimes of a crime not being able to use evidence of their victimization without facing criminal charges against them, and in fact could be threatened with charges if they do so. For example, you might have a domestic violence victim who records on her cell phone a violent assault on her or her children, a crime of violence, or an incident where he or she is being stalked. That victim of domestic violence could be charged with a felony and subject to imprisonment of up to 5 years and or a fine of up to $10,000. Without this exception, it would be very impossible, if not difficult, to have the evidence necessary for our law enforcement to solve crimes and our state's attorneys to prosecute those crimes. The Administrative Office of the Courts helpfully points out that there are not many convictions of this violation of this law because the penalty is so high. Certainly anyone would take a plea or not be charged because they are state's evidence or acted without malice. The question is not about how many people are convicted here, as would be relevant for crime fighting efforts, but this is reducing the scope of the crime so that we can protect victims. And they may be able to keep recordings for their own leverage for once. The dynamic is already unequal. Those who want to violate the law will violate the law, but those who want to protect themselves are forced to go outside of the law and pray that they will be granted state's evidence and not be prosecuted for evidence they gathered illegally. We are clearly saying that under SB 375, that recording dangerous crime against you is not itself a crime. This is common sense legislation, and you will hear from Professor John Myers of the Hastings School of Law of the University of California, who is a national expert on this issue, and our state's attorneys and other groups representing domestic violence victims. Professor Myers will answer a lot of your questions and provide the comparison with other state laws, as well as the other witnesses providing testimony and answers to your questions too. We may have some potential amendments for the voting session based on their input. We just want to make sure that we provide victims with necessary protection and that they were able to come forth to help us solve crimes against them and help prosecute them. We are currently working with the American Civil Liberties Union and the Office of Public Defender to work out concerns they have about the bill. They are the only two that are not in favor of the bill. The two-party consent statute is clearly out of date, and we need to provide our law enforcement and our state's attorney with a really effective tool to solve crimes and protect victims. So I ask my esteemed colleagues for your favorable vote on SB 375, and I'll turn it over to my witnesses now. Thank you, Mr. Chairman.
So thank you very much, Senator. All right, now we'll move on to Yosefi Seltzer. You're up next. Mr. Seltzer, you're up.
Good afternoon. Can you hear me?
We can. Welcome.
Okay, excellent. My name is Yosefi Seltzer. I'm an attorney at the JAG office at Fort Meade, and I'm speaking today in support of Senate Bill 375. I'm here on behalf of my clients who are victims of domestic violence. The current all-party consent law creates a chilling effect that intimidates victims of domestic violence from coming forward. Victim intimidation is common in these cases, with the abusers telling the victim, "No one will believe you." Maryland is behind the times. In the dismissal granted chart, the second chart in the display before you, 2021 data confirmed that more than 56% of the statewide protective order petitions were dismissed or denied. In Prince George's, Baltimore City, and Baltimore County, more than 61% of petitions were dismissed or denied. This bill can help to bolster the testimony of victims, which will persuade judges to grant a greater number of protective orders. As the chart you have before you indicates the first one, the federal wiretapping statute, military rules of evidence, along with 38 states and the District of Columbia, currently have one-party consent laws. Similar to this bill, California, Nevada, and Washington state have exceptions to admit recordings for protective orders and emergencies. As well, Florida authorizes audio recordings to prove a violation of a protective order. All four of those states are all-party consent states, similar to Maryland, but they've wisely authorized exceptions to aid domestic violence survivors. The third chart you've got before you demonstrates that the petitioners are represented by counsel more often than the abusers, which means survivors would have little trouble admitting their recordings when assisted by their attorneys if this bill becomes law. There was a time when various forms of evidence, such as nanny and security camera footage, fingerprints, and DNA evidence were debated. If authenticated audio recordings are available, shouldn't a judge be allowed to admit and hear them when evaluating witness credibility and deciding guilt or innocence? Let's not also forget that domestic violence survivors have civil rights and civil liberties and deserve to live free from violence and fear. Finally, I would request one important technical amendment. The phrase "and disclose" should be inserted after intercept in the proposed section 12 to ensure that the recordings made in accordance with this bill would be both legal and admissible. Thank you for your attention, and I welcome your questions.
Thank you very much. It's the first time someone from your agency is testimonying to disclose more. That's great. All right, bad joke. All right, we will now go on to Ms. Feinstein. Hey, Debbie.
Good afternoon. Thank you so much, Chairman Smith and members of the Judicial Proceedings Committee. Again, my name is Debbie Feinstein, and I'm here to testify in support of Senate Bill 375 on behalf of myself, my boss, John McCarthy, and the Maryland States Attorneys Association. Senate Bill 375 proposes carving out an exception to the two-party consent to the interception and disclosure of wire, oral, or electronic communications when a person reasonably believes that they're in imminent danger of becoming a victim of a violent crime, including rape, murder, child abuse, and first-degree assault. The requested change is a modest one compared to the vast majority of states that either have statutes that permit one-party consent to wiretapping. The proposed law is in many ways a compromise. There are many who would like to eliminate the wiretapping law in its entirety. There are others that would like to see the law extend to misdemeanor domestic violence cases like second-degree assault. Many are concerned about privacy and potential erosion to our individual rights. The privacy concerns must be weighed against the limited scope of this bill and the fact that our current statutory scheme prevents true access to justice for victims of violent crime. Several examples stand out in Montgomery County. The first, an Uber driver charged with rape. In this case, the victim had a significant amount to drink at a club and an Uber was called to get her home safely. She woke up alone in the back of the offender's car. She had no memory of what had happened after she left the club, but she suspected the offender had had sex with her. To confirm her suspicions, she asked the offender for a ride home so that she could confront him about the rape and record their conversation. During the recorded conversation, the offender admitted that he knew that she was wasted and that they had had sex while she was wasted. She repeatedly accused him of having sex with her while she was passed out, and the offender did not deny it. DNA confirmed that the offender had sex with her in the car. It could not show, however, that she was incapacitated. The court ruled that the recording violated the Wiretap Act and that the state could not use it to cross-examine the defendant. Moreover, the court ruled that the victim could not mention that she had even made a recording, not even to explain why she had asked him to take her home after believing that he raped her. At trial, the defendant testified that they had had sex, that she wasn't that drunk, and that she was not passed out, and that the victim instead had asked if she could see him that weekend, and when he declined, she became upset and accused him of rape. His word against hers. And she couldn't remember the rape. She just knew that it had happened. And as I mentioned, the DNA confirmed it. If I may just finish that example, and then I will not go on to my next one. May I do so, Chairman? Is that okay?
Sorry, yes, please proceed.
Thank you so much. The jury also didn't know about the prior sexual assault allegation against the offender that occurred under similar circumstances. That victim was too traumatized to testify, as is often the case in sexual assault cases. This defendant was acquitted and is now free in our community. And it's obviously of great concern. The limited exception that's set forth in Senate Bill 375 would change this outcome, would allow the state to enter this type of evidence and to be heard before the jury, and it would ensure justice for victims of violent crime. I thank you for your consideration.
Excellent. Thank you very much. All right, and for our next witness, we'll go with Professor Myers, and then Ms. Bailey, you're on deck.
Good afternoon. Talking to you from sunny California, where it's about 60 degrees. I hope you're not still under your storm that we've been hearing about out here on the West Coast. It's a pleasure and a privilege to be here with you to support Senator Lee's bill, Senate Bill 375. Interestingly, California is one of the few, two-party consent laws. And a number of years ago, a few years, I get maybe 7 or 8 years ago now, some of my students crafted a bill which found its way through the legislature and created an exception similar to the one that Senate Bill 375 would create for Maryland, which is found at California Penal Code Section 633.5. We still have two-party consent in California for confidential communications, but now victims of domestic violence can record in limited circumstances on a one-party basis. I want to just add a dimension that my colleagues have not talked about, and that is on the family law side of the equation, because that's where I spend most of my time. I represent women in domestic violence restraining order cases, and I represent kids in high conflict custody cases by court appointment. In family law in California, it was routine it was mostly women, but it could be a man, of course, for women to want to record, and their lawyer, if they had the good fortune to have a lawyer in family court, would have to tell him, you better not record his threats or his phone calls or his showing up on your doorstep and threatening to kill you and the kids, because if you do, you're going to go to jail. Family law attorneys routinely threaten to call the district attorney and have a woman prosecuted under the two-party consent law. So the students got this bill crafted that creates a limited exception to that, which is similar to what you're going to do. So I guess the message I would leave you with is that this Senate bill would have important positive ramifications in the criminal justice system, but equally and perhaps even more important positive implications for victims of domestic violence seeking help in child custody and restraining order proceedings. I will just add, and then I'll stop, that the sky has not fallen in California since the statute was amended. I haven't heard any bad comments about Penal Code Section 633.5. But it does seem to serve a positive function in both the criminal and the civil side of things. That's all I had to say.
Excellent. Thank you very much, Professor. I always enjoyed taking the BART while I was over there. You had great weather.
I took it today.
There you go. All right, Miss Bailey.
Good afternoon, Mr. Chairman and members of the committee. I am, my name is Anita Bailey, and I am a JAG attorney at the Fort Meade Legal Assistance Office. I'm the domestic violence specialist there, and we have just established a new program where we'll be representing victims of domestic violence in court in civil protective order proceedings. I'm not going to restate. Mr. Seltzer very eloquently stated our position with regard to this bill, and I just wanted to add my support to that, and also offer to answer any questions the committee may have. I've spent the majority of my 27-year legal career representing individuals in family law cases and domestic violence cases. 22 years of my career I spent in the Anne Arundel County office of Maryland Legal Aid. So as the professor stated, I believe that this bill would have very positive implications for victims of domestic violence in family law cases and civil protective order cases. and I'm here to answer any questions that the committee may have. Thank you.
Excellent. Thank you very much, Ms. Bailey. And with that, that'll conclude the testimony for Senate Bill 375. We'll switch over to the committee for questions. I had a couple. One was just Debbie or Ms. Feinstein about the hypo that you provided, just the way that it's drafted, and then one was for Professor Myers, since I think California said does operate under this exception. But for Ms. Feinstein, two things. One is under your hypo, how is this draft? I'm just trying to figure out how this actually plays out in an application, because your hypo was after the fact. The next morning, the woman woke up and she recorded it after the fact, after something happened, and got the admission after everything had happened. And I'm trying to figure, it says that you have to be in imminent danger of becoming the victim. So I'm thinking, someone's banging down your door and you're recording it, or someone's calling you saying I'm outside, or, I'm just trying to figure out how it works in application, and maybe Professor Myers can shed some light on that as well. And then the second thing is, how often are people actually charged for this violation of this part of the wiretap statute? It's got to be the state's attorneys. John would never do this. Mr. McCarthy would never charge someone under this. So I just practically speaking, how often does that happen? And I'll unmute you, sorry.
First, to speak to, if I may speak to your first question about the hypothetical, in that case, it actually wasn't the next morning, it was a continuing course, so she was still with him. So it certainly would be included. I think one of the questions that the jury had afterwards was, well, why did she stay with him? Now, when she wasn't in imminent danger, he had already raped her once, at least she believed he had raped her once. So that would be the argument that we would make. Given, I have to tell you that I have had some consternation over the language imminent danger, because it is perhaps a subjective term, although it is utilized a lot in our self-defense language around self-defense, and it's included in the jury instruction for self-defense. But we would certainly be amenable to working on that part of the language to address it, because I agree that there might be circumstances where there are statements that are made afterwards that we would certainly want to include because of the exact situation that I described, where the defendant can just then get up and lie on the stand in complete contradiction to a recorded statement. And there would be nothing that could be done to contradict that. So we'd certainly be amenable to that. And I would also agree with what you said, Chairman Smith, about my boss, Mr. McCarthy. My boss is in favor actually of abolishing the wiretapping law altogether and becoming, a one-party consent state. So I guess I could say that as well, although he's in favor of this baby step towards at least advocating for, victims of violent crime, which is really what this, and victims of domestic violence, which is really what this law is intended to do, is to really carve out this exception. And that's what we're asking for at this time. So thank you for that great question and pointing that issue out, because that is absolutely right. Although the fact in this case, I believe would have encompassed it, but there are many other cases where it would not if it was an after the fact recording.
Senator Lee has attempted to nibble away at this portion of the statute from different angles over the years, and I've always been skeptical, but you are making a more compelling case here today. But okay. This is a tough one. All right, Senator Sidner, go ahead.
Thank you. I think I tend to find myself with the chair. I know that when I make phone calls here in the state of Maryland, I have this protection that I don't have someone recording my phone conversations. So, while I understand, I think what you all are trying to get at, again, I'm wondering, so if you have this situation, you as a prosecutor, and this is from Ms. Feinstein, you would just, I'm assuming you would take, if I'm recording someone who's violated, let me back up. If someone has threatened me and I've recorded that phone conversation illegally, I'm assuming that you all aren't going to be trying to prosecute me. You're going to try to figure out some ways to help get at whomever it was that violated that law. So the point of this bill isn't necessarily to protect me from violating the law as I'm attempting to protect myself, but it is to do what?
Well, I think it's exactly what Mr. Seltzer had said about the chilling effect. People are afraid to use this tool because they are afraid that they will get in trouble because it is in fact illegal. And everyone kind of knows the Linda Tripp case that happened in Maryland, or lots of people know that. But more than that, I recall Mr. Seltzer telling me a story where he had a victim, and we've seen victims in our cases where the victims have the recordings, don't want to share them with us, don't even want to tell us that they have them because they're afraid that they're going to get prosecuted. We might find out even after the case is all finished that these recordings existed because they didn't even want to tell us that they had recorded the rape, that they had recorded the assault, that there was a camera in their house recording the assault, because lots of people have just cameras internally for security reasons in their house, and we wouldn't even be able to use that with audio. So I think that is really sort of pointing to why this is so necessary, is that chilling effect, because it is in fact illegal and many of our citizens don't want to do illegal things. And, I would also note, with respect to your comment about, being on the phone and feeling that you have that protection, as long as you're doing something legal, you have the protection, right? I mean, this law wouldn't allow, an ordinary conversation to be recorded. However, we've looked at cases where public officials have been the subject of stalking and harassment, where there have been multiple calls to their offices, to their homes, and that sort of thing. And we are not able to, they aren't able to record that. So we don't have the content. And if we did, and this law had passed, we would be able to potentially use it if we had a stalking case or something worse that was being created by that, by that phone call.
In that case, wouldn't you all? I mean, in that case, your office would have the ability to get a wiretap or something to see what's going on, though, right?
They would, but I guess when we're thinking about, then that's someone who has maybe the wherewithal to do that. But we're talking about vulnerable victims who wouldn't have that knowledge, wouldn't have that wherewithal, and are just afraid. That's really who this law is going to. I guess I was just sort of picking up on the example that you had given, but really what we're concerned about is the victim of domestic violence that's getting, routinely beaten and sets up a camera to record it so that it can be captured. The other example I was going to give actually related to a child care facility where it was an in-home daycare where the daycare provider was routinely smacking these little tiny children under the age of 5, threatening them, dragging them around, and she was also threatening.
But again, under the law, that would be admissible except for the audio. The video is still admissible, right?
Maybe.
It should be because there's nothing that violates. I mean, that prohibits.
Some judges.
I remember this from 2015 when
right.
Exception for the body cameras for the officers. And what I remember from that conversation was that the video was admissible, but it was an issue with the audio.
The issue is the issue is actually a lot of judges don't see it that way. A lot of judges say this is an illegal interception because of the audio, and we're not going to allow you to use any of it. And you can read the existing law to mean exactly that. And actually, in that case, the chilling effect was on the daycare assistant because she was so afraid of her boss, who was doing the beating, that her boss was also threatening her, and she was trying to capture all of those threats, those verbal threats, which wouldn't have been captured just by the visual piece of the video. But either way, it was that was what her concern was, and that was a case that we had where we couldn't use the video either.
But there's enough legislative intent and stuff that's out there that one would think a judge would be able to know that this law deals with audio and that video is admissible. But I appreciate your comments. So thank you.
Thank you so much, Senator.
Senator, I appreciate that. I was actually thinking about that exact scenario, Ms. Feinstein, that you brought up, because I was thinking if I have a nanny cam that pipes into my phone, and God forbid I witness something, it's got audio and video. What are her expectations, and can I use that? And that was fascinating. So, all right, that's interesting that it's being construed that way. But I got to roll with Senator Sidner on that one. It's certainly not But anyway, okay, go ahead. Senator Heddleman, go ahead.
Thank you very much, Mr. Chairman. I have to say, it troubles me a little bit, and I guess I'm going to direct this to the professor. It troubles me, and I know they're here for the next bill, but that the domestic violence advocates that we usually hear from in support of legislation that protect survivors are not weighing in on this bill in support of it. And so my understanding is that there are lots of concerns about how this will be used, and it could potentially be used against people who are survivors of domestic violence. And so I wonder, in places where there is this sort of exception, whether that has been the case.
So Professor Myers, let me go ahead and unmute you here. You should receive a notification on your screen that'll ask to unmute. There you go.
I think the senator asks an excellent question, but I think it's not a real issue, to be honest with you. I just think it isn't. I mean, will some perpetrators misuse this statute? Yes. Will some people who are claiming to be victims but really aren't victims misuse this statute? Yes. The question is, when you balance the greater good to be achieved by the passage of this statute, whether, and that's, of course, that's why you guys get paid the big bucks to make those hard calls, right? And in this case, I think it's pretty clear. If we just ask ourselves, what is the best evidence of threats to kill somebody? It's not pictures, it's words. And in my experience doing domestic violence work for a long time on the civil side of the agenda, it's threats. And if we have this bill, some of those threats that are real and are clearly the best evidence that a woman needs protection will now be admissible. And the second issue is what one of my colleagues mentioned, I think Ms. Feinstein, is the chilling effect. California, before we amended the statute in California to allow this very limited use of audio taping, the family law bar and domestic violence advocates just routinely said, no, you cannot record anything or you'll go to jail. Now, the chairman asked, do prosecutors really prosecute? Of course they don't, because if they think this is a real victim, they're not going to charge the victim with doing this. That doesn't solve the problem of the poor prosecutor is trying to prove this case beyond a reasonable doubt. But the flip side of that is, if a prosecutor believes and a law enforcement agency believes that this supposed victim has misused your statute, then the prosecutor will charge. That's, of course, the case where the person should be charged with violation of whatever the appropriate charge would be. I would just say that you're going to find risks and benefits on both sides of this equation. And I would say that the benefits of this clearly outweigh the risks in terms of protecting real victims and getting the best evidence that we can use both in the civil arena and the criminal arena to do that. And then I would add by saying, again, the sky has not fallen in California since we amended our statute.
A follow-up to that is, but for this exception, do you think, I mean, how many cases would you say turn on this, that you wouldn't have had evidence to prosecute otherwise?
Every day. Now, I don't have a study that supports that, but I know in my own practice, what I used to tell women to do before we amended the statute in California is I say, you can't do it, or you could get in serious trouble. So arrange for a meeting at a park where it's not a confidential communication and record it there. Well, that's asking a lot of a victim to do, but that's what I had to do when I was talking to women. I say, you can't record it at home where you're getting the threats. You can't record the phone conversation wherever you are. So I tried a 4-day trial in which, fortunately, the woman recorded it at a custody exchange in front of a church on a public street. And that's the only reason we got the evidence in. And I won't repeat what he told her, because that would sting your ears, and I don't want to do that, Senator. We wouldn't have had that evidence if it had been in a private home. We might have had it under the current version of California law.
Thank you.
You're welcome.
I did want to, Mr. Seltzer and Ms. Feinstein, if you want to chime in, I did want to, if it's responsive to the senator's question.
Yeah, I just wanted to follow up on what Mr. Myers proposed here. And, again, I'll restate the numbers. 56% of the statewide protective order petitions in 2021, last year, this is the most current data we have, was dismissed or denied. In Prince George's, Baltimore City, Baltimore County, more than 61% were dismissed or denied. A lot of that is failure to appear, but there's a lot of folks that can't meet the evidentiary burden without that audio recording to corroborate their testimony, or they're just scared. They're intimidated. They without that recording in their pocket, they are too scared to show up at court. I don't know any other way to put it. And I think Maryland can do much better.
Einstein.
Thank you so much. I wanted to speak to Senator Heddleman's comment that we see many of the domestic violence advocates actually on the screen ready to testify on another bill this afternoon. And I want to reflect on MNADV's informational that they filed in on this particular bill. And I've had some conversations around this as well, and why I pointed out earlier about the language of imminent harm. I know that there's concerns around that and whether a victim would have to prove that they were in imminent harm. And that's something that I know in speaking to Senator Lee's office that we're amenable to working on that language. And, you know, I recall I was actually in a meeting a week and a half ago discussing this bill, and myself and another colleague were saying, you know, you don't want the perfect to be the enemy of the good, but perhaps we can get it more perfect. You know, better language that would be, you know, more comfortable language that we could do it, because I certainly, the point of this bill is to not chill, right? And to not have this chilling effect. And if the language in the bill causes a chilling effect, then that's something certainly I know that Senator Lee's office, you know, we've already discussed potentially working on and would welcome suggestions around that language.
All right, excellent. All right. So with that, so for honestly, if there are additional questions, seeing none, that will conclude the testimony. And we'll move on for Senate Bill 375, and we'll now move on to our next bill, Senator Waldstreicher with Senate Bill 328. Vice Chair Waldstreicher, you're up.
Thank you, Mr. Chairman. This bill simply modernizes our stalking statute to include electronic stalking, including the use of electronic trackers. Most people know these as air tags or tiles that you can affix surreptitiously to someone or their vehicle or their bag in order to track their movements. There's no opposition to the bill, but I want to address, because I know Senator Lee has a similar piece of legislation. So I just want to say how these two are different and how they actually go together. So Senator Lee's bill is a training bill requiring that we train our police related to this increased use of electronic stalking. This bill is the actual update of the stalking statute. And so these bills are not in competition at all. I support Senator Lee's bill 100%. In fact, these bills go hand in glove and can move together. Let me give you an example of how this works. So as many of you know, I knock doors every weekend. I was knocking doors in Garrett Park, which is in my legislative district. And I knocked on the door of a woman who had this exact same thing happen to her family. She went through a challenging divorce with her husband, and after the divorce began seeing another man. Her ex-husband surreptitiously put a GPS tracker on the vehicle of her new boyfriend and tracked the new boyfriend everywhere he went. She went to the police with this, but the police couldn't do anything because it doesn't fall within our current stalking statute. This bill simply remedies the circumstances of those hypotheticals and all those who are unfortunately doing similar things right now in our community using very easily accessible and relatively cheap technology. So with that, Mr. Chairman, I would ask for a favorable report.
Excellent. Thank you very much. All right, we'll now move on to your panel. And first up, we'll go with Ms. Shapiro. Welcome.
Thank you, Mr. Chairman, Mr. Vice Chair, members of the committee. Melanie Shapiro with the Maryland Network Against Domestic Violence for the State Domestic Violence Coalition. I'd like to thank Senator Waldstreicher for bringing this legislation. It's very important that our laws keep up with technology as it advances, and that's exactly what this bill does. It doesn't change a penalty. It merely adds into statute what is the most common and current form of stalking that we're seeing right now, and that is that of using technology. One of the things I would encourage all of you to do after the bill hearing is simply Google AirTag stalking, and you will come up with a plethora of articles from today and yesterday and last week. There was just a personal safety guide that Apple put out in response to the proliferation of stalking being done with these AirTags. And AirTags are something that are on the common market. You can buy them on, Amazon, or go to the Apple site and order them online. But there's also all other sorts of technology that can be used and put on a person or put on a vehicle and be used to track them. I want to share with you the importance of having our stalking laws reflect what is actually happening, because there are 7.5 million people that are stalked every year. Women ages 18 to 24 experience the highest rate. Current or former intimate partners are responsible for stalking 61% of females and 44% of male victims. And studies show that 76% of women murdered by an intimate partner were stalked. So stalking is in fact a predictor of lethality. And in addition, those that reported stalking, 81% indicated that they were also experiencing some form of physical assault by that same partner. So stalking is an indication of lethality, an indication of forms of physical abuse, and also these other risks. And so it's very important that our laws are updated and that this statute is amended to include the electronic technology that is being used to stalk today. So for all of those reasons, we urge a favorable report on Senate Bill 328.
Thank you, Ms. Shapiro. All right, next we'll hear from Ms. Jordan.
Thank you. Good afternoon, Mr. Chair, Mr. Vice Chair. I'm Lisa Jordan with Maryland Coalition Against Sexual Assault. We're also here in support of Senate Bill 328. Some of what I was going to say really has already been said, but I did want to emphasize that this is not only a domestic violence issue, that we hear from many people at the Sexual Assault Legal Institute who really have no relationship to the person who dropped an AirTag into their bag or suddenly is tracking their car. There are people who maybe became attracted to them and, someone turned them down, but they're still continuing to go after them. So they're rejected suitors. They're people who have evil intent. They're people who are maybe jealous. They may be people who are interested in you because you're a public figure or because you're a performer or because they just like the way you look. So this is something that's very easy to do now, and our law is just not capturing it. I also wanted to say that it's not that AirTags are inherently evil, right? They are great for your kid who always forgets their backpack and you want to leave the AirTag and you can track it down, or you don't remember where you parked your car in a strange town. I mean, there's nothing inherently troubling about the AirTags themselves or the similar devices themselves. It's really this particular use. The other really important part of Senate Bill 328, thank you so much, Vice Chair Wallstreicher, for introducing this, is that it will affect not only the criminal law, but also our ability to petition for a protection from domestic violence, sexual assault, or file for a peace order. So it really has an effect in both the criminal justice system, but also our civil justice system. For those reasons, the Maryland Coalition Against Sexual Assault strongly supports Senate Bill 328.
Thank you very much. All right, next we'll go on to Ms. Feinstein.
Thank you so much. Good afternoon again. Debbie Feinstein from the Montgomery County State's Attorney's Office. I want to say me too. I actually did the same thing that Ms. Shapiro did. I Googled stalking crime and AirTags this afternoon just to check it out, because I remember getting an alert a couple of weeks ago on my phone about AirTags and stalking and some information that Apple had put out. It has become increasingly prevalent. Electronic communication tracking devices are the stalking method of choice, it would seem, in 2022. And as technology evolves, so must the law. The current statute for stalking does not specifically delineate what conduct means. It says malicious course of conduct, but it doesn't give any definitions around what that conduct is. This Senate Bill 328 provides some legs to that. Provides not only to demonstrate sort of and to make a path of prosecution more straightforward, but also provides a deterrent effect to the community. So the community is specifically on alert and knows that this is considered stalking and that this behavior is significant. Right now, a penalty for a first-time offender being 5 years. And that is of great concern. This committee has already heard, again, from Ms. Shapiro about the high correlation between stalking and homicide. And really that's where sort of the passion piece for me comes into this. We know the nexus between stalking and homicide. We know that it's important to deter stalkers. We know that stalkers are using electronic communication and tracking device. Senate Bill 328 creates this clearer path to prosecuting this method of stalking, a deterrent effect, and also a prohibitive effect, so that people will understand exactly what the law prohibits, and hopefully stop this insidious behavior and diminish the nexus between stalking and homicide. Thank you for your time. I also stand ready to answer questions. I would urge your support.
Excellent. Thank you very much. All right, next we'll move on to Ms. Lennig. Here you go. Hold on.
Thank you, Mr. Chairman, members of the committee. My name is Dorothy Lennig. I'm the director of the legal clinic at the House of Ruth. The House of Ruth serves victims of domestic violence throughout the state of Maryland. We're here today to urge a favorable report on Senate Bill 328. First, I want to thank the sponsor, Senator Waldstreicher, for introducing the bill. I'm going to make every effort not to repeat anything anybody said. I think a lot of people thought that this was already the law and kind of forget that the stalking statute was originally enacted in the 90s before there was all this electronic communication. So the law now really does require somebody to either physically follow or pursue another person. So all this electronic tracking of people and the misuse of electronic equipment, that's not really stalking under the current law. You're going to hear from lots of witnesses. You've heard from a lot of witnesses. I just wanted to point out a few things that people have raised with me. First of all, while the bill proposes to change the definition of stalking, it does not remove the requirement that the act of stalking has to place a person in either fear of an act of abuse or cause serious emotional distress. So you still have to prove that. The state would still have to prove that. Also, it's not stalking if you're doing it for a legitimate legal reason, if you're following a court order or there's a commercial purpose or there's something else that's authorized by law. So that is specifically excluded. Third, stalking, harassment, and misuse of electronic communication are 3 different crimes. They have different elements that have to be proved and different penalties. So some people have said to me, why doesn't this fall under all those other crimes? But I think if you look at the statutes, or you can ask one of the assistant state's attorneys, they can tell you what the different elements are. And finally, while this updates the law, for those old-fashioned people who still want to physically pursue somebody or follow them, that's still under the stalking statute. So let's bring the stalking statute into the 21st century. And I urge a favorable report on Senate Bill 328. Thank you.
Excellent. Thank you very much, Ms. Lennig. All right, next we'll go with Ms. Ruth.
Good afternoon, Mr. Chair, Mr. Vice Chair, members of the committee. My name is Laurie Ruth. I'm the legal director at the Women's Law Center in Maryland. I want to thank Senator Waldstreicher for sponsoring this bill. You've heard plenty already. I think there are more people who are going to testify, so I don't want to waste too much time. But in my written testimony, you'll see a reference to a website that is devoted entirely to how to try to achieve safety and avoid being stalked technologically, and it's called techsafety.org. And in it, it goes through all sorts of kinds of electronic stalking that you haven't even heard about yet today. Some of the products that are used to stalk people are actually provided by the manufacturers and producers of the products that we all use. And I said this before, the biggest one of all is the cell phone. So you will see, if you look at techsafety.org, just the broad variety, including all sorts of stalking techniques that come programmed onto your phone if you want them. And so it's everywhere, and everybody now carries a phone. I think in the years I've been coming down here, we used to have problems because clients didn't have cell phones and we had to work around all that. Now, I have to say about 98% of our clients have a cell phone. It's very rare to find a client without one. And that's a major part of electronic stalking. I also wanted to say that Miss Jessica Emerson can't make it here today. She asked me just to also offer her support for this bill on behalf of the Human Trafficking Prevention Project at University of Baltimore School of Law, which they operate in conjunction with Maryland Volunteer Lawyers Service. And her testimony is really unusual because they work with a very specific population of people who have been trafficked. And this is particularly complex and scary for traffic victims who are very, very tied into the electronic world. So I commend you to her written testimony. And for all of those reasons and everything you're going to hear about, we recommend a favorable report on SB 328. Thank you very much.
Excellent. Thank you very much, Ms. Ruth. We'll now move on to Sheriff Popkin.
Good afternoon, Chairman Smith. Always good to see you, members of the Judiciary Committee. Thank you for the opportunity to testify on Senate Bill 328. My name is Darren Popkin, and I am the Sheriff of Montgomery County, and I chair the Legislative Committee for the Chiefs and the Sheriffs Association statewide. And with the administrative responsibility of running the Family Justice Center, Montgomery County's Domestic Violence Center, there is not a day that goes by that we are not provided information involving these forms of electronic communication harassment. This would include tracking devices and all forms of electronic communication. As the laws have not kept up with this ever-changing technology, the ability to protect victims of domestic violence, as well as other crime victims and witnesses through stalking statutes, has become increasingly problematic. Senate Bill 328 will close this loophole and enhance these protections and allow for certain stalking offenses to be charged, but only when appropriate. It is for these reasons the Maryland Sheriff's Association and the Maryland Chiefs of Police Association support Senate Bill 328 and request a favorable report. Thank you, Mr. Chair.
Excellent. Thank you very much, Sheriff. Good to see you. Next, we'll go on with Mr. Engler. I saw someone else in the screen. There you go, Brett. There you go. Miss Engler.
Thank you. Thank you, Mr. Chair, members of the committee. My name is Brett Engler. I'm a prosecutor. I'm the chief of the Domestic Violence Unit in Frederick County. I'm also chairperson of our county's Domestic Violence Coordinating Council. I signed a letter of support from the council in favor of this bill on behalf of State's Attorneys Charlie Smith, Frederick County DVCC, and the MSAA. We urge a favorable report. I'm not going to go over again what my colleagues have said. We know that stalking is homicide in slow motion, particularly as it relates to female victims. But I wanted to share a story of a survivor of stalking that I had just in early 2020. She dated someone for about 3 months. He started calling her repetitively after she broke up with him. She would get obsessive phone calls, texts, social media messages. When she wouldn't respond and told him to leave her alone, he always spoofed numbers. He would try to text her as if he was a different person. She got a protective order, but she decided not to proceed with it because she was told by his attorney that he would lose his job and that this would be very bad for him. Instead of moving on and taking her kindness, he continued to harass her, forcing her to get another protective order. She started to feel like someone was following her. She felt just like a constant sense of dread. She had her car spray painted, her tires flattened, but she could never see him around her. Eventually, she took her car to a mechanic. She found a GPS tracker at the bottom right corner of her car. Law enforcement poured resources into this case, getting a search warrant for the tracker, showing who had bought it, and it was her ex-boyfriend. The tracker was really key to myself being able to prove a stalking charge in that case, but because our law was so outdated, I offered counts to pleas that I could really prove. So electronic mail harassment, protective order violations, those were easy to prove, but to this victim, stalking was what happened to her. And those charges that he pled guilty to carried a lesser penalty. It didn't truly reflect the nature of what had happened to her. And I told her that I would share part of her victim impact statement with you. She said at sentencing, "I'm terrified when he gets out of jail, when to see him in public or the community. I don't believe that this will end. I weigh whether I'm going to leave Frederick, my loved ones, my life, my family, in order to feel comfortable again living. He will always make me walk cautiously, date cautiously, trust cautiously, and always feel uneasy in my life." The mental abuse was overwhelming, and she was very upset that the state didn't proceed on stalking charges. So I do urge a favorable report on the bill so that we can save lives. Thank you.
Thank you very much, Ms. Engler. All right, next we'll go with Ms. Emerson. Emerson's not here. All right, Ms. Snyder.
Good afternoon, Chair and members of the committee. I am here today. My name is Rebecca Snyder on behalf of Executive Alliance, which is a professional women's organization that focuses on changing the conversation about women in Maryland's workplaces. We do that by elevating women leaders to boardrooms and executive leadership roles. We are here in support of Senate Bill 328, which, as you know, strengthens the definition of stalking. And you've heard a lot of testimony about this bill, but I wanted to make the connection between the effects of stalking and the workplace. So, because it is a significant workplace issue. There's a lot of facts and figures in my testimony, but if you think about the effects of stalking, many victims, no matter their gender, are forced to change jobs, even change careers. Victims experience work performance issues, inability to concentrate, lost days because of court proceedings or just because of life. And so they're having to remake their life over and over again. And so stalking holds every victim back, but it's an especial issue for women because 1 in 6 women will be stalked in their lifetime. There's research that shows that Maryland businesses are more vulnerable because of stalking. So nationally, about 44% of stalking incidents result in workplace violence. It's an issue for workplaces trying to keep their workers safe. And it's an economic issue in that every victim of stalking loses approximately $730 of productivity each year. And so when you extrapolate out those numbers, it's a massive problem for Maryland's workplaces. It's a social and devastatingly significant issue for the victims of stalking. And this one change, this enlarging of the definition of stalking to include electronic communications can do a tremendous amount of good and create a broader tool to keep people safe. We urge a favorable report. Thank you.
Thank you very much, Ms. Snyder. We'll now move on to, I think that's the last witness. If Ms. Emerson is not here, and I'll ask Sandy if no one is in the waiting room. Is that right? All right. So then that is the last witness for the bill.
Yep.
Great. So we'll now turn it over to the committee for questions. Seeing none, that'll conclude the hearing for Senate Bill 328. Thank you very much, Vice Chair Walsreiger, and to the panel. And that also concludes the hearings for today. So I'll see you all tomorrow on the floor. Have a good evening. See you all later.